organizations, we're individuals, we're groups. When you become into that organizational culture, when you just are talking of organizational speak, that's when you lose a little bit of your soul. Sometimes you have to listen to what your soul is saying, what each other are saying, not just what the organization is saying.
So now we're going to have questions from the audience.
Thank you so much. Anyone who has any questions, you can come here and take them.
Good morning. Irene, I really loved the analogy which you said, the emotion is a messenger. And I just want one bit of a support.
Brian.
Good morning.
I really appreciate your talk. I thought you have a lot to be proud of for everything you've accomplished. My question to you is, what do you think is the most important aspect of prevention? You mentioned that was the way to go. What do you think is the most important aspect of that?
I think it's education. Like, it doesn't matter what we do, any procedure that we give to the patient. Sometimes I feel like we're pulling them along even, but the most important aspect is education up front, right? We have to get their buy-in. They have to take accountability for their disease. It's their body, it's their disease. We're here to help them. We can take them right up to the water, but the second you try to make them drink, you're going to lose every time. We've seen it. We have tailored our program over the years to be, maybe it feels even
I just have a question because as much as you're saying diabetes is a vascular disease, it's actually a disease that affects all the body. It literally shuts down your body one part
Right.
at a time. So my
within the patient. And when they don't have that, they don't get better. I mean, I've never seen, trying to think, if I've ever seen a really ornery person just heal quickly. I don't think I've ever seen that.
I think me and you need to talk,
Yeah.
because healing is within ourselves, and there are a lot of spiritual within ourselves. It probably would make the health profession go out of business, but let's talk.
Yeah, I'd love that. Thanks.
Hi. As a functional nutritionist, we know that diabetes, especially type 2 diabetes, is mainly a lifestyle disease. It was supposed to appear after the age of 40, but unfortunately, I'm seeing children with 12 years old that they are getting diabetes type 2. And in your education, are you focusing, especially when the mother and the father, if it's a lifestyle, if they eat the sedentary lifestyle, the junk food they're eating, they're always on the screen, they're not moving, so they are developing this disease and the complication of this disease at a very early age. So, and I feel like we were able to reverse some of pre-diabetic patients or diabetes at early stages. We were able to reverse once we changed the lifestyle, like she said, the lady, sleeping, exercising, but also mainly is insulin resistance. We focused a lot on giving them tips and tricks on how to avoid insulin resistance, and food plays a major role in along with the sedentary lifestyle in preventing diabetes. I wanted to know what in your education program, what do you really focus and you're seeing it's working with diabetic patients?
From a nutrition standpoint?
Not necessarily. Do you focus on nutrition, or you focus also on lifestyle, on mind, body? What exactly works for you? So it's to inspire us also to add it to our system.
Yeah, that's a good question, and I think it varies patient by patient. Everybody is an individual with individual needs, and so it's not really a one-size-fits-all
Sure.
on what works, right? But our approach, it's nutrition, which is a consult with a nutritionist, depending on how their score is on their mini nutritional assessment on their first visit. The second thing, from an educational standpoint, is teaching the patients how impactful their disease is to their whole body. It's their mind, it's their organs. I mean, it ravages your body, right? Or it can if it's left unchecked, these high blood sugars. Helping them understand what's going on. And I think sometimes it scares them. Sometimes I wonder.
Maybe this will empower them to change,
Yeah.
to start applying what we teach them.
Right, totally. Yeah, and that's why we do it. We're not trying to scare the patients, but this is your reality, right? Do nothing, here's where you're going. Or if you can take control, take accountability of the disease, we can go a very different direction.
You know what, mainly what they do, they take the pill, and they think that by taking
Yeah.
the pill, and I can eat whatever I want, and this is the main problem, that they continue with their life, just taking the pill, and they don't know how serious it is and the complications, as you said.
You're so right about that. Even these GLP-1 medications that are so
Yes.
powerful, and they can be they are so powerful, and they can be so effective if you make the lifestyle changes along with that, right? You
Yes.
have to do that part. So that would be the other thing we talk about, is what does lifestyle changes look like?
Thank you.
Yeah, thank you. Okay, thank you, everyone.
Check. Thank you so much, Dr. Brian, for reminding us that health is not just the absence of illness, but the presence of balance in every part of lives. That was truly a thought-provoking and grounding session. I thoroughly enjoyed it myself when we spoke about how we can reverse type 2 diabetes. Our next session zooms in on a major turning point in the healthcare world. It is titled Integrity AI in Healthcare, Caution versus Rapid Adoption. Everywhere we look, AI is showing up in diagnostics, workflows, patient monitoring, even in how we think about prevention. The real story isn't just AI. It's how differently organizations are choosing to bring it in. Some are moving too fast to unlock new capabilities. Others are taking steadier route to make every step is safe and sound. This conversation explores what those choices mean for future of care. Please join me in welcoming our the next panel and our moderator on the stage, Dr. Vijay Jagannath, Senior Consultant of Presense Health. And let's allow me to welcome our panelists on the stage, please. So please join us. Our first panelist joining is Narwa Farhan, Corporate Quality Patient Safety Director at Dr. Suleiman Al Habib Medical Group, followed by Dr. Omar Tujar, President, International Society of Medical AI, followed by Zafar Iqbal, Manager Imaging Information Systems, Sidra Medicine, followed by Dr. Pietro Emanuel, Thriving Healthcare Strategist and Founder at Thriving Healthcare, followed by Ashwin Bell, CEO at Presense Health. Thank you so much for a wonderful panel and our great moderator. Over to you, Dr. Vijay. Can you check your mics before I go on the stage?
Check. Hello.
Check. Check. Check test.
Hello. Hello. Yes. Good morning, everyone. I am Dr. Vijay Jagannath. I'm a senior consultant in anesthesia and also the Associate Director of Medical Education from Qatar. And welcome to this panel on one of the most important conversations in modern healthcare, integrating AI in healthcare, caution versus rapid adoption. So in 53% of medical groups or expanding their use of AI, almost double the number, 23. So this pace is extraordinary. With speed comes responsibility as well. And AI is no longer a future concept. It is already influencing diagnosis, scheduling, reporting, triage, and patient outcomes. And in many cases, it has entered our clinical workflows very quietly. Healthcare has always adopted innovations cautiously, guided by clinical evidence, training, and professional standards. Yet with AI, we are seeing tools deployed before clinicians are fully trained, governance structures are mature, or ethical questions are fully addressed. So today, our goal is not to say yes or no to AI. Our goal is to explore how we adopt it at a pace that brings benefit, ensures safety, protects trust, and prepares our workforce with the right competencies. We have an outstanding panel with expertise across clinical practice, technology, policy, ethics, and innovation. So I'm looking forward to an honest, practical conversation about benefits, risks, and the pathway to responsible integration. So let me set the stage. My question is, to all the panel members, from your perspective, is the current pace of AI adoption appropriate? And what do you see as the primary force driving this acceleration? Is it genuine clinical need, or is it financial pressure, or is it drive for innovation, or is it influence from industry? What is your thought?
Hello, everyone. And thank you for this introduction. Well, I believe AI, it's coming. It's a wave of new development. It's coming towards us, towards the healthcare domain, and we just have to ask ourselves the questions. Are we going to be crushed by this wave of technology, or are we going to be able to surf it? So the answer really, or the question is not really whether we're going to, implement it fast or slow. The question is whether we're going to have governance over this technology, because we, as healthcare professionals, really, we should be able to govern the way this technology is implemented in the hospitals, in the healthcare settings, before it governs us. Because the risk here really is a transfer of power between, from the healthcare providers to the corporations. And we can't really accept that because we're bound by our oath and by our ethics. So really, we shouldn't really be against this technology. I mean, as I said, it's coming. We just need to be able to control it. So, and the benefits of it are outstanding. You know, there's massive benefits to this technology. It will most likely improve efficiency, performance. It will most likely help us reduce our rate of errors in the long term. So there is a huge benefit to this technology. However, we should be also aware of the drawbacks, of the risks, of the possible complications. So, for example, the black box problem, the transparency, the explainability. There is something called algorithmic bias, where those tools are trained on a certain set of patient data that not necessarily is reflecting the actual population. So there's many things that can happen in the background that maybe clinicians are not aware of. So really, we need a framework around this technology. As you rightfully said at the introduction, we're not against the technology. Healthcare has seen many revolutions in time. What we need to be aware of is the governance framework around this. And that's why we developed the International Society of Medical AI, where we have a forum where clinicians, as long as policymakers, the key decision makers and developers as well, meet to discuss this topic, and where we focus on how are we going to implement this, how are we going to create a governance framework around this technology for safe implementation. And among those topics, obviously there's preparedness, staff preparedness, hospital preparedness, internal frameworks, governance, readiness inside the hospitals and outside the hospitals. So I'm looking forward for the discussion with our colleagues here, because I'm sure you have a lot of things to say around the preparedness, staff preparedness, technology development, and governance frameworks as well.
Anyone else wants to add? Well, what's the biggest drive for this acceleration in AI adoption at the moment?
Yeah, thank you so much, Dr. Vijay. I think before that, I would like to say just one little comment. I think AI is like a rapidly moving train, and today or tomorrow it will stop on your whatever the workplace is, and I think it's better to be on board, because if we miss that train, I think we'll miss what's upcoming and what's already there. So I agree with Dr. Omar. AI is coming. Actually, AI is already here. I was in Chicago last week for like one of the biggest medical imaging conferences. I was so surprised to see that like almost half of the exhibition was full of AI technologies. And AI is not just now coming in software, it's more like in hardware. I saw so many like ultrasound machines, CT machines, MRIs. AI is built in on those equipment. I mean, we never thought that. I'm in a medical imaging field in like for more than 18 years. I never thought that while you are doing the ultrasound, and I really saw that with my own eyes, while you are doing the ultrasound, a pop-up comes up that this patient has a benign lesion or like a mass lesion. So I think AI is already here. We need to work on some governance part. We need to work on some biasness issues, but it's already there. And yes, we should move with caution, but rapidly. So I think that's my thoughts on it.
Thank you so much. And this is a very specific question to Mr. Nawar. With your background, how important is patient and clinician engagement before deploying an AI tool? And what is the most effective way to involve safe and acceptable implementation in healthcare?
Thank you very much, Dr. Vijay. I think clinician engagement is extremely an important factor in the not in terms of the speed, but rather in the alignment of the healthcare organizations with the implementation of AI. One of the things that sometimes lead us to think that it's coming too fast is the fact that we're not ready for it. We have not laid the groundwork in our organizations to be ready for AI adoption. So our competency-based assessments are not there yet. Our clinicians are not engaged from the start. Our patients don't know that AI is being utilized as a part of their care, or don't know how it is being utilized. So we don't have that full transparency. Our governance structures are not there yet. And definitely the regulators also play a part of it, because they also need to be a partner in all of this implementation. So the clinician engagement is extremely important, and I think it starts from the development phase. So co-creation with the clinicians is an important part of things. The other thing is engagement of the entire organization, not only those who are at the point of care where we're utilizing AI. We need to engage the entire organization of what it is, what we're using it for, what are the limits, what are the safety features, and what are the safety red zones that we're looking at. How can we tell that there is a problem? And that's very important, because if we can't tell there is a problem, then it goes back to the fact that it's a black box, and even in a concept, even from a concept point of view. And in healthcare, we all know that that's a very dangerous zone. So we need to know how to detect problems when they happen. We need to have systems in place that audits problems. We need to have the human in the loop from the very start. We need to have tiered education levels at different levels of the organization, from across the organization, for leaders, as well as, of course, for those who are engaged directly in the implementation of AI. So all of those things are very important. But on top of that, we also need to engage our patients. And we need to understand how we can do that engagement in a way that provides them with simple yet effective information and not take the choice from them. So I think that's extremely important.
Thank you. Thank you, Ms. Nawar. I fully agree with your views. With my education hat, we would not allow a clinician to perform a procedure, prescribe a drug, or use a tool without proper supervision and assessment and check their competencies.
Absolutely.
Right? So AI shouldn't be any different, especially when it heavily influences diagnosis, treatment, and also the patient outcomes. And I think adoption without education is not innovation from my point of view, it's abdication of responsibility. Okay, so I fully agree with your points. Now, Dr. Omar, you're a clinician. So what safeguards are most critical in high-risk areas, such as intensive care or emergency care or radiology, to ensure the clinicians maintain sound judgment and do not overly rely on AI? Yes.
Well, you know, this is a common question, and it's been the topic of discussions at high level, especially at the European Union and WHO level. In fact, the European Union has developed a framework. It's called the EU AI Act, where the technology, especially when used in those high-risk areas, it's highly regulated, really, because of course, in those areas where you mentioned radiology earlier, you know, it's very tempting to have a tool where you just, you know, plug in the X-ray or the CT scan, and it just tells you what it is, right? It's very tempting. But what are the drawbacks of that? You know, I mean, there's so many hidden risks. Of course, there is the explainability problem. You know, the machine gives you an answer, but you don't really know how it got to that conclusion. We know that it's trained on a database, but again, the database can be biased. So the database we should have access to, but it's a black box. And then, there is a problem of this data being processed in clouds that are owned by corporations. So there's also a patient data, problem there. And at the end of the day, when you have these high-risk entities like ICU, X-rays, or emergency department, the decision-making is critical, and you cannot delegate your clinical decision-making to a machine, because then you enter a liability problem. You enter a liability problem where, if you have made a mistake, if you made an error in judgment, then who is it really liable? Is it you as the clinician who's taking the blame, or is the corporation behind the AI algorithm, or is the hospital? So there's a problem with liability there, right? And at the end of the day, we always have to see and to put the patient at the center. The patient is always at the center. So you wouldn't want to have your mother or your family member being dealt with by a machine without having the human in the loop. So the human has always to be involved in the loop, and the human has always the clinical judgment, the empathy, and the experience to judge together with the machine. We're not against the technology. We have to be working with the technology to have a better experience. So there's a lot of regulations around it, and we have to be cautious. Yes, we have to implement it fast. I agree with you, doctor. However, we always have to see it from the patient perspective. We cannot, as you said, start using a technology before vetting the technology, before ensuring it's safe, ethical, and dignified.
Mr. Zafar, I'd like to ask about the implementation realities. So many organizations, they want AI, but they may lack the data, workflows, or IT readiness. What are the key operational challenges that you anticipate, and how can AI avoid adding administrative burden or even alert fatigue? For example, if you have too many frequent, low-value alerts, that can desensitize people, and that can ignore the alerts, and that can put the patients to risk. So, what's your thought?
That's a very good topic of discussion. So we have implemented several AI solutions lately, and they are actually working well. So I think I have a list of some, like a lesson learned. My first lesson learned is the team. The team is very, very important, who are delivering or working on any of the AI projects. And AI, to be honest, in my opinion, is not an IT thing. It has nothing to do with IT. It's purely clinical. As far as you are implementing in a healthcare, it's purely clinical, because it's the clinicians who actually give you the data. That's our second point. Once your team is formed, the next point for any successful AI implementation is data. And that's where the biasness comes in, what Dr. Umar was mentioning. You need to know what you are actually going to achieve from any of the AI implementation, and data is the one that sets the stage. So data is very important. Sometimes biasness is good, but it depends where you are implementing. For example, we are a pediatric hospital, and most of our vendors, they approached us, and when we asked them where you trained this model, and most of the models were trained on adult imaging, which is like 18 plus, and that doesn't work for us. We actually tried a couple of solutions, and that's a very good companies, but they failed miserably. So that's very important, that you know what your data is and you know what your outcome is. So the team is very important, and the data is very important. And once you have the data, the annotation of the data, the pre-processing of the data, the cleaning of the data is also very, very important in order to get the best of the results. So once you have the data and once you have the team, the another important step is to decide, okay, are you going to have a commercial solution, or you have the capability to develop your own like an in-house solution. So we actually tried both. We had a commercial solution, and we are in process of developing our own AI algorithms. We have a very good team of data scientists and engineers. And to be honest, it's a cheap. When it comes to cost, the commercial solutions are way more expensive than building your in-house. but definitely things come to play a role, which are the governance. For example, the commercial solutions, we have FDA approval, we have CE approval, we have different ministries, different countries approval. But when your in-house comes, you may not have any kind of such approvals. But to be honest, if your clinicians agree with what AI is giving you as a result, that's your approval. And that's what they do in FDA, that's what they do in CE. So when you're forming the team, the clinicians, they play a very, very like a key role, and they are the ones who are going to give you the data, they are the ones who are going to annotate the data for you, and they are the ones who are going to validate the results for you, even if it's a commercial solution or even if it's an in-house built solution. And I guess lastly, it's important to implement those, like deployment. Where are you going to deploy those solutions? These days we have almost every cloud provider, they provide you good GPUs. Google is one of the best. We have Amazon, we have Azure, we have Oracle Clouds, or you can even buy your in-house servers in your own data centers. But the deployment is and integration with your workflow is very, very important. The workflow part is like top of the list, where the AI is going to help you. AI cannot solve everything for you, and AI can solve nothing for you. So it's you have to decide in which workflow step AI can assist. And replacing, I was attending a keynote session last week in Chicago, and I like one of the points in a great talk, the media hype around AI. To be honest, this replacing of humans by AI, we see that 200 million jobs will be lost in 2023, 400 million jobs will be lost in 2020, like 2035. It's all fake, to be honest. It's a purely media hype. AI cannot replace any human. AI, some administrative or clerical jobs you can argue, but any decision-making job, any clinical job which is related to the treatments of the patients, no AI, not even another 100 years can replace any of the humans. It can assist, and it will assist. It will assist in a very good way, and it will definitely increase the confidence of the clinicians as well. Once you have a second opinion already on your table, and you can plan your treatment accordingly, I think that's a really great for the patients and for the clinicians as well.
Thank you, Mr. Zafar. That was a good insight. Now, switching the gears a bit, this is to Dr. Pietro. So what ethical and regulatory concerns worry you most when adopting AI in healthcare, and what governance structures should hospitals have in place before deployment?
Thank you. I think that's a very good point that we should explore. Looking at the governance structures that most hospitals nowadays have, they are completely inadequate for adopting AI and robotics with safety. There is a need for a bespoke structure, a bespoke architecture for AI governance, starting from a clear vision at the board level. We know that a lot of hospitals have deployed sandbox programs to start a piecemeal adoption of AI, but without a clear strategic vision. And then there is a need to find the right people to form a board or a panel of experts. And as our colleagues mentioned, it's not your typical IT department. We need experts in AI that understand how the algorithms work, how they can be trained, how you look inside the black box and fiddle with it. You need to have experts in information governance. You need to have experts in human ethics and clinicians, and hopefully a representative from patients and the public as well. Once you have that structure on board, you can start looking at pre-deployment checks. assess which route you want to go, sourcing the right algorithm, the right product, or develop that in-house. And you can start looking at mitigating other risks. So for example, looking at the trainability, the training data that you can choose to reduce bias. You can look at how you manage then an ethical review of this product. You can start looking at how it performs with your local population. You can then implement performance monitoring once the product is in use. For example, you want to be able to detect when the algorithm deviates from the expected behavior before it does any damage. Implement a structure to report concerns by clinicians as soon as possible, and for the experts to be able to understand why that has happened, liaise with a company. You might want to prepare for the worst case scenario when the algorithm is completely out of control, how you shut it down and revert to manual processing without disrupting your workflows and so on. So all these escalation protocols and override mechanisms are things that currently do not exist. And then we also need an element of regulation externally. We mentioned that a lot of countries are deploying bespoke legislation about AI and robotics. If we look carefully at what many countries have done, there are a lot of regulations about how you use it, but very little change in accountability rules. For example, from a clinician point of view, we are a bit in a Wild West situation in many countries where we are given products and we're told, well, if something goes wrong, the ultimate responsibility stays with you. You have to do the final check. But it's like giving us an assistant that is never trained, like having a secretary that you never can fully rely on, and you always have to double check what it's doing. We need to have that change in culture and legislation that allows a shared accountability when something goes wrong.
Well, thank you so much for that, Dr. Pietro. So on the same issue to Mr. Ashwin, how should accountability be shared amongst clinicians, organizations, and industries when AI influences clinical decisions? And in your experience, what factors are most important for clinicians and patients to trust AI systems?
All right, good morning, everyone. Thank you for the question. As many of the folks on the panel have already said, I think accountability is going to be a big issue, liability is a big issue that everybody is pondering on in terms of how to incorporate AI into their day-to-day. As we see it now, the accountability portion gets spread quite evenly. The liability portion perhaps does not. We know that the industry produces these kinds of technologies, provides it to the clinicians, but at the end of the day, as many have already alluded to, the clinicians matter the most in terms of what actually happens to the patients from a treatment perspective, from an intervention perspective, guidance perspective, etc. So AI in healthcare especially is not necessarily artificial intelligence that's trying to replace doctors. I would think of it as more of an augmented intelligence helping doctors think better. And in that perspective, as one of the panelists just said, everybody's worried, at least in the news and media, that AI is going to take over jobs. I feel like AIs will not take over other people's jobs, especially in the clinical field where human touch is primarily important. It's extremely important and will remain important as long as humans exist. But doctors who are more adept with AI, clinicians who are more okay with using AI and incorporating AI are the ones who are going to take over other people's jobs, who are not. And I think that's really where we see things going. So accountability, I see it being spread between 3 different silos. First one is the clinicians themselves. As I mentioned, very important human in the loop, takes on a lot of the responsibilities, certainly takes on the liabilities. It has always been the case, and I think it'll continue to be the case. The next is the organization itself, the hospital or any of the clinical settings that you're going to implement these AI technologies. they will have to take on the accountability of how do they enable systematic adoption of AI into their workflow. For example, if there is an AI that has been introduced into the system, the first thing they need to explain is if the result is X, then the action should be Y. And without that sort of a clear, lines drawn to what the action needs to be, how they need to consider and interpret the results, I think it's going to be a mismanaged approach towards incorporating AI into hospital setting and clinical setting. And then the third silo I think that is really important is, of course, the industry themselves. These external regulatory bodies such as FDA, CE, and so on are there to ensure that patient safety is met, but yet on the it's like a double-edged sword for them, or rather they're between a rock and a hard place. These regulatory bodies, on the one hand, are taking care of patient safety while allowing innovations to seep through, and they technically contradict each other. So it's a very difficult place, and I sympathize with the regulatory bodies right now, especially because they have to compete with AI engineers who are being scooped up by Google and others and so on, but they have to keep up with the technologies that are being implemented. So industry has to do its part in despite the lack of speed at which the regulation is catching up, they themselves are responsible to ensure that they are producing models that are trustable and reliable. Secondly, I think in healthcare, a reinforced learning-based, continuous learning-based models might not be, at least in the near future, when I say near, I mean about 5 years, acceptable. It's going to have to be static models that show repeated performance measures over and over again. And clearly, demography is an issue, so they need to have model cards that describe this is how it was trained, this is how it's implemented, and this is how it could fail, no matter where they go, because each geography has different ways of thinking about how the models might work. And so that's where I think accountability gets shared between these three silos. Trust is a completely different aspect, I think. For me, trust almost seems like I look back when when I was a young kid, before I knew how to ride a bicycle, I saw my friends riding bicycles. It looked amazing. That's how AI is. It looks amazing. But I didn't have the trust that I could balance it myself on those two wheels. So it is one of those things where you have to, at some point, decide to climb on the bicycle and start riding, fall a few times, and then build trust. And then all of a sudden, you're a world cycle champion, whatever. It becomes easier to go from point A to point B with a bicycle. So I believe the same thing is going to be very true with AI adoption in hospitals. There is going to be a sense of awe for clinicians when they see AI being demoed and shown to them. But there's also going to be a lack of trust in being able to think about, can I ride that bicycle? And so there is no other way other than the organization itself supporting the doctors and the nurses in imagining what their life could be with AI in small ways. Baby steps at first, and I'm sure it's going to take off no matter what. So that's my thought on that.
Thank you, Mr. Ashwin. So what do you all think? Is it try and fail with AI, or it should be just fully prepared?
Well, I'll jump on that quickly. For every, healthcare has seen many revolutions in time over the centuries, right? And we eventually embrace those technological advancements. However, like in modern times, you can't really deploy a new technology without having that tested. And that goes across the board, right? You can't really start using a new device, a new medical device, without having that, gone through multiple tests, quality tests, approvals, and frameworks and regulations and whatnot. So really, AI is another medical device at the end of the day. And so it's important to understand that. It's not just, an assistant. In many cases, it's also a device or a tool that, helps you making diagnosis. And by that, by definition, it becomes a medical device. So we have to be aware of, yes, it's beautiful, it's breathtaking. Honestly, it's a beautiful technology, and we should not be against it. We should not be against it, but we should really be aware of the possible risk. I mean, we can't play with patients. So we have to be aware, is this technology reliable? How is it deployed? Where is the data going to? Is it going into a cloud that it's used by a, obscure corporation to train it on other models? So where is this patient data going? So there's a privacy concern. The outcomes, have they been validated? Are these tools being validated? Have these tools been gone through research and, you know, randomized control trial and validation, as we do with all devices, really? So those are concerns, those are real concerns, and we just have to, yes, it's beautiful, it's breathtaking, but we just have to kind of stop a second, you know, and have a conversation. Where is this going? Can we develop a framework? And as Dr. Pietro rightfully was discussing the importance of the frameworks, and that's why at the society, the International Society of Medical AI, we're having that exact conversation, and we're developing the frameworks that are going to be used in the hospitals, the governance framework, the accountability, the audit framework, and the committee structures to be able to deploy this technology safely. So it's a big conversation, and we have to, you know, kind of take a break, you know, take a deep breath, and have this talk. And it's wonderful that we're here today, because honestly, this is what we need, you know, discussing this, where this is going, and the risk of it. So yes, we should implement it. We should not be afraid of it. However, let's just be the adults in the room and consider all the possible facets of this discussion.
So I think one important aspect to say is, we're not here to say we shouldn't jump in this train, because I think the train is going whether we're jumping or not. However, I think the one important aspect is the fact that we need to move from AI adoption or implementation to AI stewardship, and think about governance, think about safety consideration, risks, how our teams are interacting with it, the human factor of things, and the human factor will extend beyond the clinicians, but also with other healthcare providers and the patient themselves and their families. So we need to think of this as a comprehensive stewardship program for all organizations that are looking into, you know, a real and widespread implementation of AI. And this program has to be in collaboration with governance bodies, with patients and patient advocates, and with payers as well, because the payers would love to know what they're paying for, and are we being efficient about it or not. So we need to have those stewardship programs implemented in order to ensure that we are on the train, but we have our seatbelt on. So that's very important. Thank you.
Yeah, if I may quickly add something, and I think that's really important. The organization in itself has to develop frameworks where you can constantly continue to monitor these AI models to ensure it is producing the results that you expected it to produce, producing the results that the industry said it would. And this is something where I think a lot of the institutions, healthcare institutions, need to put their resources towards. As one of the panelists did mention, many of the hospitals are now trying to build AI themselves, but they end up competing with talent that is very difficult to get to build a reliable, good, strong model. What should also be resource allocated towards is the fact of monitoring existing models and understanding whether it works or not. I mean, from a trust perspective, right, I used to be an academic. We used to publish on models for a decade plus now, just talking about sensitivity, specificity, PPV, workup to deterioration, and then you have to think about, oh wait, workup to deterioration, 1 over PPV. So it's just one of those things that's never intuitive. A person who's been there for 20 years doing that, it still takes me sometimes a Wikipedia page for me to remember what exactly that means, and how do I put it in context of this particular medical device. And so I think the healthcare organization should come up with frameworks, put resources to keep monitoring, keep understanding, given the context of the AI and what clinical problem it's solving, what are the observed results. And that team should exist in all hospitals so that you can build trust as we move forward.
So, yeah, thank you very much for that. And what we have heard today is that AI has extraordinary potential. But we have also heard clearly that innovation without education, oversight, and ethical guardrails is not acceptable in healthcare. And the future of AI in healthcare is not about choosing between caution and rapid adoption. It's about choosing informed, responsible adoption. That means involving clinicians, educating the workforce, building transparent systems, and ensuring that patient safety remains the anchor of every technological decision. Now I'm going to open, the questions to the floor.
For any questions, you can come here next to the mic. Thank you.
Am I allowed 2 questions? Oh, thank you. Thank you so much. And ma'am, I'm glad that you brought the health plan. Because for the last couple of days, we've been only talking about health systems and not really talking about health plans. So I'm really glad that you brought it up. My first question is, McKinsey Global AI report that got released said 88% of the organizations have started using AI. But 80% of those organizations do not see any value. And they are still stuck on that co-pilot mode. So with the adoption, this rapid adoption and the topic that we're talking about, how do we ensure that adoption and using of AI is also translated to an ROI and value?
Well, I'll jump in on this. Yeah, this is true because, I mean, the question is, and I was talking to one of the CEO of one of the biggest private hospital groups in France, and the question was, how is this technology going to give me any financial benefit? You know, because are we seeing an investment in this? There is a lot of money spent, but what is the ROI? What is the return on investment? I mean, is this really going to improve the efficiency in terms of financial gains for the hospitals? And this is a question posed by private hospital groups, really, because there's a huge investment, there's a huge money involvement, but really, if the doctor has to double check everything, you know, then the question of efficiency and performance, you know, it's a bit more gray. So yeah, there's a big question on that, and the answer is that the developers, and this is something that we discuss at the society often, you know, some of the mistakes they do is that they focus on the clinical aspects of medicine. So they develop tools that they're looking at clinical, you know, diagnostic tools, something that the doctors are very, very good at. Instead, what the developers should do is they should focus on something that the doctors are very, very bad at doing, which is time management, you know, looking through the charts, you know, improving the patient's flow, the patient's efficiency. So, I mean, we are tired of looking through the charts or, you know, summarizing patients, you know, discharge outcomes or reviewing or, you know, going through medical histories. Instead, those things are very, you know, very easy to do by a machine, so the machine can help in that regard. So the machine should focus on improving the efficiency where the efficiency is lacking in terms of medical flow, instead of focusing on what the doctors are really good at, which is diagnosis. So doctors are good at that, so leave us alone. Instead, you should focus on the paperwork. And that's where you see the return on investment.
Thank you very much.
Just
Any
wanted
further
to add
questions?
Sorry, Vijay, I just wanted to add one thing. We have fantastic technology called ambient technology that can help also with documentation and summarizing and generating correspondence and having legal proof documentation that will never be as good as what we can produce as human beings. So focusing on what can really help the organization first before we go into the nitty-gritty of what we're already doing well. I totally agree with Omar.
Thank you.
Thank you so much. My second question is more regarding to the health plan. With all of the AI being adopted within the health system, obviously the coding is getting better, right? The coding intensity has improved. How does the coding intensity impact the reimbursement and compliance on a health plan standpoint? Because now with AI, with autonomous coding, your entire NLP to read all these documents and ensuring that the coding goes and, you know, the claims are being submitted correctly, how does that impact the reimbursement? Because the coding intensity has really gone up. So how does a health plan prepare to ensure that the coding intensity is being taken care of, ensuring that the reimbursement and compliances are in place?
Mr. Ashwin?
Yeah, I can touch on that. I think, you know, we spoke a lot about the institutional healthcare side, the hospitals and the doctors and such. We are expecting them to take on AI and make it a part of their life what you bring up is a very important aspect, which is, I think, 1/3 of healthcare, which is insurance side, right? And so they also need to start figuring out how to utilize healthcare. And tying it back to what Dr. Omar said, don't help us do things that we're already good at. I think the insurance might want to see that part a little more on the AI side, if I may say so. Because I think the insurance companies think if there is an error on judgment side from the doctors, from the nurses, I would like to know before I reimburse that patient for it. Or if there is unnecessary treatments being provided or treatments, and this I'm talking about a global scale, it's a problem. It certainly is. And certain kinds of things, insurance would like to know about it. So if there is an insurance-driven mandate for hospitals to also start thinking about clinical outcomes through AI and improvement of clinical outcomes through AI, then I think you're seeing that sort of road meet in the middle. On the one side, you have doctors and nurses and hospital administrators saying, we need to be AI friendly, we need to be AI forward. On the other hand, you have the insurance company also saying, yes, you need to start adopting AI to improve outcomes. And I think ultimately who ends up benefiting is the patient. But certainly governance, everything has to catch up. We are not there yet. AI seems to be moving faster than other fields, in other fields than in healthcare. But in healthcare, because of regulation, there is that bottleneck for innovation, which I think is a good thing. And so the clinical adoption of AI will take longer than other fields, but by then governance structures, et cetera, should have caught up.
Thank you.
Hi, I'm Renee Anand. My background spans chemical quantum physics, genomics, and medicine. I spent most of my life in medicine, and the first thing I'm going to tell you is the word AI should never have been brought into medicine. It's neither artificial nor is it intelligent, okay? What it is simply a coding of physicians' intelligence in machine language. So what you should have really named it was coded human intelligence. And because you call it artificial, it's now scaring the hell out of everybody because they think this is this autonomous robot that is going to make a mistake and kill me, right? And so everybody's up in arms about, oh my God, we can't have artificial intelligence in our lives in medicine. The reality is thousands of years of doctors studying, learning, putting in practice common wisdom is now being coded. So I find it very unsavory to use the word AI. It is mathematics, okay? And mathematics is human over time. Look at mathematics history. So what I'm trying to say is get rid of the word AI and call it coded natural intelligence. That is you guys and how you have learned through practice what you do in all the domains of medicine, from imaging to diagnostics to thing, because then the insurance, the people, the patients, everybody will feel safer, because right now they are very upset that they won't have any human contact. And that is the key in medicine too. We are humans. And so anyway, I'm not really asking a question. I'm trying to say, can you guys please get rid of AI and call it something else in all your titles so that the progress of what happens efficiently is more human. So that's my
How would you call it?
I said coded physician intelligence, medical intelligence, any of those things, medical intelligence would be lovely, but don't call it artificial. There's nothing about it is artificial. And it's not intelligent without you.
I just want to add
There's no
something.
intelligence, zero.
What he mentions, actually, I'm having a deja vu moment. My first publication in AI, in healthcare, was in 2010. And I went to a conference very similar to this, about 150 people were there, most of them doctors, and I used the word artificial intelligence in 2010. And I got questions which were very similar to this. There was this dystopian thinking around, oh, AI, artificial intelligence, is going to take my job, et cetera, et cetera. At least that's the sense I got by the questions I received.
If I might say something right now, in a previous panel, they said like 30% of students are not going into medicine anymore because we're going to have a shortage of doctors because they're thinking this artificial thing is going to take over everything in medicine. So, sorry, go ahead.
Yeah, so I think, so my response to that was, of course, I was in shock, and I decided not to use AI again. So if you see all my papers after that, on this, it was machine learning. We used to call it, it was very technical, very I'm an engineer background. So machine learning was the words we used. It was machine learning until, as someone rightly mentioned here, Sam Altman changed it for us. The AI terminology, please don't think clinicians or folks associated with hospitals and doctors and technology here are the ones marketing that term. It's a term that was started, that caught fire. It wasn't started by Sam Altman, of course, but ChatGPT, OpenAI somehow opened up this Pandora's box of what AI is, what AI could be. It is definitely misunderstood. And today we are in that froth. I think a few years from now, that froth will reduce and people will start understanding how it truly impacts lives. We've already seen, somebody mentioned just now, 88% of those AI initiatives are failing, which is very expected, and I'm not surprised, because people are throwing, if they have the term, if let's say my name is Ashwin and I somehow had an A and I in between all of that, I would have made that capitalized. That's how companies are running today. Everything is AI. They do something on Excel sheet, they call it AI. It's unfortunate. We are also in that same boat, and we've been dragged along with that froth. But I'm very certain healthcare is that steady boat that's going to stay afloat and take care of what needs to be taken care of when it comes to adoption of AI. Because healthcare has gone through many revolutions, and healthcare is filled with highly educated, highly thoughtful people who will make sure this will be adopted correctly.
Yeah, I think I'll have a quick comment. I think, to be honest, it should remain AI because it's artificial. No matter how you code it, no matter how you like make it beautiful or make it like in whatever you do, you cannot compete it or you cannot relate it with human intelligence. There is no relation between human intelligence and AI, and that's why it's artificial. It's just like artificial jewelry cannot compete with like a real gold or real diamond. No matter how you polish it, no matter how you make a great design out of it, but it is artificial and it will remain artificial. I think it has to be artificial. No computer, no program, no like GPU, no like big machines can compete human intelligence. It's just how humans are. The machines are new, humans are like from the day one of this universe. So it is artificial, to be honest, and it will be artificial. Yeah, for sure.
Okay, thank you very much. Really insightful discussion. So my question is, with AI evolving faster than regulatory and clinical systems, when new models of collaboration between medical devices company and healthcare providers are needed to really drive ethical and responsible adoption of AI. So we talked about accountability, clearer frameworks, but is it really the key making these boundaries like outstanding right at the front, like early in clinical kind of training as well?
So sorry, is the question that we're putting boundaries a bit too early in the development phase?
No, I'm questioning, is it correct defining boundaries early at the early stages? Is it really the key to drive this kind of ethical and responsible adoption between manufacturers, companies, hospitals, as well as patients?
Well,
How can we improve
yeah,
that?
you can go ahead there, Petri.
Yeah.
Thank you. I think that's a very good point. There is probably not one single right answer. When I prepared what I call the healthcare convergence framework that I published in my recent book, The Doctor's Future, I emphasize the need for collaboration, and it's multi-agency collaboration that is crucial. Multi-agency meaning the developers, the clinicians, the regulatory bodies, the legislators when it comes to liability, the public when it comes to the perception, how we interact with artificial intelligence, how do we interact with the machines, how do we perceive the interaction between the doctor and artificial intelligence. If you look at it from the perspective of, for example, the manufacturer, you can perceive that we are over-regulated. If you look at it from the point of view of the organization, the patient, the clinicians, we would say we are under-regulated. I think we need to work together to make better regulations that have a balance.
Yeah.
Yeah, I mean, as we discussed before, as for any medical device or medical product, you do have to go through, regulations and approvals and frameworks. I mean, there's no way around that, honestly. I mean, if you look at simple, like any drug, new drug, has to go through trials, multiple trials, stage 1, 2, 3, etc., and then only 10 years after that you can market it. I mean, that was not the case during the COVID vaccine problem, but normally any kind of drug has to go through, multiple steps. And that goes also for medical equipment. Medical equipment and medical devices have to go through approval protocols and quality checks, and there is regulations around that too. And as we said before, AI, when it's used for clinical workflows, it is a medical device by definition. And in fact, in Europe now, every new medical AI product has to go through CE certification mark, as well as ISO standard compliance. And that obviously can delay production, and it does delay production, honestly. And in Europe, we have a problem in that regard. Whereas in other places, there is no such tightness. So for example, in the US, perhaps it's less regulated. So it's easier to go there and try it. In other countries as well, we were discussing India yesterday. It's a different framework. So different areas of the world have different regulatory frameworks. But in general, the rule is that you cannot deploy this technology unless you really have some sort of compliance framework around it.
Okay, thanks.
I think the topic for today was really lovely, and each one of you have shared your insights so beautifully and precisely. I have just one simple question. These days, there are a lot of cases where despite multiple checkups, blood tests, or diagnosis, patient's disease remains, unidentified or undiagnosed. There could be certain signs and symptoms, or probably, misdiagnosis. My question here is, with the growing adoption of AI in healthcare, do you think the challenge of a delayed or misdiagnosis can be effectively and, most importantly, timely resolved?
Somebody want to say something? Yeah, I mean, we said it. Yeah, sorry. Yeah, you're right. I mean, look, AI at the end of the day, it's pattern recognition, right? This is what it is, and it does help. I mean, we're not against it. We're saying it's a beautiful technology, and it will help a lot in terms of pattern recognition, reducing the errors. I mean, medicine is riddled by human error. I mean, it's the third leading cause of death is medical error. We have cardiac, we have respiratory, and then you have medical error. That's the third leading cause of death. So, I mean, it will help in that regard, and we should not, be afraid of using that or deploying that for that in that sense. And this what goes back to the efficiency discussion we had, where AI will be helpful in improving efficiency and performance, and medical error falls into that category because it will prevent error. Therefore, it will improve the efficiency of the entire hospital system. Now, how we really detect the errors and the patterns, it's important, to have, again, a good model that is trained properly with a good population, data set that is trained across board, and and the training model is validated so that we can safely deploy it in the hospital. But it will be absolutely helpful. And there will be a problem in times, by the time we adopt the proper model, we will still see medical error happening, but it will be a transition phase where at some point we will deploy it, and at that point you will see an improvement in medical error. However, there will be a time where we're not going to be able to deploy it, and we will still see the medical error that we currently do.
Just to add one point, let's be futuristic. Precision medicine. We know that very often we work with limited amount of data. We do a physical examination, we collect a history, we do some tests. But with the adoption of all the omics, microbiomics, genomics, metabolomics, proteomics, we can greatly enhance our diagnostic capability and our therapeutic capability. And that's something that only AI can help us with. Our human brain cannot possibly analyze such a vast amount of data, such as your whole genome, the amount of microorganisms that interact with your body, your personal lifestyle. So going fast in the future, having AI at our side will definitely help with having better, more precise and faster diagnosis.
Thank you so much for the answer.
Hi, thanks so much for the panel. Quick question for Dr. Navarra. As a director of corporate director in patient safety, I wondered where the education is helping with connecting the gap for clinicians, and what are the steps you guys taking in this space? Thank you.
So thank you very much for your question. And as we've mentioned within the panel discussion, education is an integral part of this adoption or implementation of AI, because as even mentioned by some of the panelists, would you allow a physician who didn't go to medical school to take care of you? Would you allow a surgeon who wasn't trained in a surgery to open you up and do a surgery for you? It's the same thing for AI. We need to have competencies. We need to include it in our credentialing, our privileging. We need to have multi-tier education levels for all of the staff, for specialized staff, and for leaders. So having comprehensive educational programs as an integral part of the implementation is not a choice, it's a mandate. And it should be regulated through several regulators, and it should be mandated even as a part of the implementation package. And this is where I suggested stewardship as opposed to just simple implementation, because there are so many different factors. Thank you.
My question was more specifically on patient safety. And I wonder if you have frameworks already developed for this?
So in terms of patient safety, the work is still ongoing on that. However, indeed, there are KPIs that you have to monitor in regards to patient safety. The number of safety events or near misses even, as opposed to every 1,000 patient encounters. Being able to do the failure modes prior to the implementation of AI solutions, and revisiting those failure modes. And this is where a governance body within the organization, the healthcare organization, is very important to review, revise, and give feedback to the developers of those solutions.
Makes sense. Thank you very much.
Sorry, but we have to, I'm so sorry, but we have to cut short. Okay. We are already exceeded the time limit. And looks like this was a very interesting panel, and the room is still full of questions and a lot of curiosity on their faces. But these panelists and our moderator, they are going to be available throughout the day, throughout the evening, and of course tomorrow. You can definitely go on questioning them. Can we please have a picture with all of you first? Thank you so much for being a great audience, and trust me, even I enjoyed this session thoroughly. Thank you so much.
So as a panel, we agree that innovation and responsibility should go hand in hand for successful adoption. Thank you all for joining us.
That's right. Thank you so much, sir. A round of applause once again for a great moderator and a wonderful panel. Never-ending questions in this room. Thank you so much, sir. You can all exit towards that side, please. Thank you. Thank you so much. Moving on, our next session is an essential one because it speaks to an experience far too many women share. Symptoms overlooked, pain minimized, concerns dismissed. These moments don't just hurt emotionally, they lead to delayed diagnosis and real health consequences. That's why today's fireside chat is When Pain is Dismissed, Ending Medical Gaslighting with Ethical Innovation in Women's Health. It is so important that we'll be exploring why this happens, how it impacts care, and what ethical, innovative solutions can finally start to shift the system. Please help me join with a round of applause our speakers, Dr. Vindhya Gemaraju, Senior Consultant of SO Health Corporation, followed by Dr. Deepak Ravinder, Director of Berkshire Center for Pain and Lifestyle Medicine, followed by Shanila Chaudhary, CEO and Holistic Fertility Expert at Holistic Pin Cups. This stage is going to be full of critical conversations. That means the questions are going to be critical, and I request you to keep this at the limited time as possible, and of course your phones on silent once again. Thank you.
Check, check, check. Oh, yes.
Check. Test 1, 2, 3. Check. Check test.
Nine years. It takes 9 years for a woman in the UK to be diagnosed with endometriosis. 9 years. But she doesn't get diagnosed while she's in her 20s. She gets diagnosed when she's in her mid-30s to even late 30s. 9 years of gaslighting. 9 years of saying, it's only a period pain. 9 years of crying in the bathroom. 9 years of not being able to reach that promotion because she's had too many sick days. 9 years of not being heard. And that's what I see day in and day out. And by the way, if you look like me, or if you're a woman of color, it's not about the time. You might never get diagnosed. And this is the reality of gaslighting in women's health. There's not enough conversations, and this is also minimized. It's just a woman's problem. Every woman has a period. What's wrong with her having the period? And what's wrong? It's every woman goes through it. Why are you in so much pain? I'm Shanila Chaudhary, and I am the founder of Holistic Pin Cups. I myself went through 1, 2, 3, but 5 devastating miscarriages. Bad luck, I was told. So I decided to do something. I decided to become the therapist I couldn't find. Because I had a choice. Do I become a mother yearning for a child? Or do I become that therapist that can help women have children? And now I'm proud to say I have helped hundreds, if not thousands, of women get pregnant naturally and successfully. But I can go on, but this panel is not just for me. And I have 2 esteemed guests with me. And I want to start because we've decided to do it a little bit different. You see, you can do the speech, but you never remember the questions. I'm going to start with Dr. Vindhya. I would like her to introduce herself, if that's okay. But I've also got a question that you can answer as well.
First, let me introduce myself. It's a privilege to be here with such a change makers. So let me introduce. I'm Dr. Vindhya Gemaraju. I'm a senior obstetrician, gynecologist, laparoscopic surgeon based in Hyderabad, India. I'm a founder of SO Health Corporation. I specialize in very advanced gynec surgeries, which we call it as a venous surgeries, which is a scar-free surgery where we operate through vagina, where there won't be any pain and no scars. Along with that, I do a unique 360-degree integrative women wellness model where we focus mostly on the preventive and restoration of the women's health. So my journey into the women's health has started a decade back when I heard the women repeatedly saying that why I had not been heard before. This changed my thinking as a clinician. As a clinician, I see many women suffering with PCOS, endometriosis, adenomyosis, and fibroids, and chronic pelvic pain. When they are able to diagnose through investigations, they had been treatment. But when they are not able to diagnose, they used to be heard about that saying that this pain is not there, and this is not real pain, and this pain is in your brain, and this is normal, as Shanila said, and it is normal for women. So this led to the misdiagnosis or sometimes delayed diagnosis, delayed treatments, and there will be misdiagnosis along with the unnecessary use of lot of medications and surgeries. So overall these years I understood not being a good surgeon is enough. I need to be a good listener, and I need to educate the patients and women, and I need to help them to heal in their process. So overall these years I developed a women care plan where I have combined the things, like as a doctor I know what all the things which is the scientific evidence based medications, surgeries, along with the natural wellness protocol where I combined the physical fitness with the mental well-being. I added the yoga, I have added the nutrition and the herbal infusions which are therapeutic, so to help the women in their pain. So today I am here not as a doctor, as a voice for the woman who has been said that pain is not real, it is there only in your brain. So with a clear-cut care pathways, we can help them heal not only physically, emotionally, but through their lifestyle changes. As an obstetrician and gynecologist, I am compassionate about the women's health, and I have a clarity how to do it, and have a courage to say no to the procedures which are truly not required. Thank you.
I would request Dr. Deepak to give his introduction, if that's okay.
Absolutely. Thank you, Shanila, so much there. So good morning to all of you. It's been a wonderful day yesterday, and really honored to be part of this panel this morning. So my name is Professor Deepak Ravindran. I'm a consultant within the National Health Service and a specialist in lifestyle medicine and pain medicine, originally trained in India, but now working for the past 2 decades in the United Kingdom. Essentially, my clinical work and my academic work spans this breadth of pain, chronic pain, lifestyle medicine, focusing on long-term conditions, especially in women with regards to pelvic pain, autoimmune conditions, long COVID dysautonomia. And what I've realized is this topic today, women's pain that we talk about, the concept of medical gaslighting, the concept of misdiagnosis, delayed diagnosis, something that was mentioned in the previous panel. This is a structural and a systemic problem globally that we need to address more urgently. There's a lot of changes there. And so actually, in some ways, my key mission through my center is been to talk about raising awareness, talking about trauma-informed care, talking about lifestyle medicine-based practices, awareness of social determinants of health, and my work in clinical practice is involving bringing all of that together to give a more integrative approach to my patients in my service. So I'm really honored to be part of this conversation today and to have that sort of ethical innovation that we're going to speak about, and that cultural humility that we need to have when we address something such as women's pain. Thank you.
I'm intrigued. Dr. Vidya. In the healthcare system, where women's pain is often dismissed or over-medicated, how does your surgical innovation like V-Notes and your 360-degree integrative model offer not just better outcomes, but a radical shift on how women are seen, heard, and healed?
Thank you for your question. This is an important and powerful question. So the pain in women is dismissed. It's not it is not obvious, but it is a subtle, because we see this dismissal of pain in a rapid prescriptions and lack of clarity and lack of patience to listen to the patients. So in my clinical practice, I have started doing in two ways. So I have two tools. One is the 360-degree unique model, where I will personally sit to the patient, talk to the patient, and I have a team of people who will cooperate with me, like physiotherapist, I have psychiatrist, I have nutritional therapist, yoga therapist. All these people will sit together. So first what we will do is we will sit with the patient, talk to the patient. So every patient may not be able to open up in a single visit. So we'll ask them to come to us after second visit or third visit, depending upon that and how they open to us. So once they open to us, we try to talk to them clearly what is their problem. Not every problem is physical. Sometimes it may be there mentally also or emotionally also. So we try to talk to them. And after that, we sit and write a proforma for them. And we give a proforma to the patients and women depending upon their disease or on their problem. So in that we will ask them about their lifestyle, how much sleep they have, how much sedentary lifestyle they have, what is the nutritional status, and what all the dietary habits they have, and what all the conditions, preconditions like thyroid they have, anything like hypertension, diabetes, and we assess the physically like their weight, height, waist to hip ratio, everything. We assess physically and sleep and stress levels, everything will give a proforma to them. We will ask them to rate that, whether the stress is 8 according to the scale, we ask them to rate either they have a stress level of 8, 10, or how is her sleep levels. All those things we'll try to ask them, and we will ask them to write it down on a proforma. After that, we will prepare a personalized and tailored protocols for every woman who are suffering with the certain type of diseases. So in that, we give you some exercises, therapeutic herbal infusions depending upon their problems, and we will do the yoga, and we always do these exercises 5 days a week, and we'll give a break. So their muscle get their relaxation time. So we ask them to we ask and encourage them to do these things for at least 3 months with us, so that they will have a definite protocol how to do it. Because many patients I have seen saying that, okay, madam, we are doing it, but we are not able to come to there. So we will help them how to do it and how to daily plan accordingly. We'll help with them. And not only for the women who are in the adolescence age group, reproductive age group, who are trying to plan pregnancy, who are not feeling well, especially in the menopausal and perimenopausal, because of the hormones are getting down. So all stages of women, we will try to prepare a protocol for them so that their life will be happy and healthy. If this is not working for them, and after trying all these natural ways, still they are not able to get relief of these problems, then my surgical intervention will come. This surgical intervention which we do, we call it as an V-Notes, which is a vaginal natural orifice transluminal endoscopic surgery. This means we operate through vagina where there will be no cut and pain will be free. Many women fear of pain and lack of time because of their professional works and their personal commitments. So they fear of getting their surgeries done very fastly. So they get delayed for the surgeries also. So their problem will get more and more aggravated. With this newer innovation, which is very beneficial for the patients because the recovery time will be very fast. When we do surgery, we will discharge the patient within 24 hours after the surgery, and we will ask the patient can resume their works within 7 days. So this is very fast recovery will be there, and psychologically also, if the patient does not have any cut on their tummy or on the vagina, they will feel more relaxed that the surgery was not done that way. So they feel more relaxed and they get up to their more work even in emotionally. So these two models will help me to treat the women problems, and this will help us to treating with dignity. And whenever we stop medical gaslighting, when we start listening to the patients, we have seen many women getting treated without pills. This is more important, because the most important thing they want us is to participate in hearing their problems and helping them in healing. So what my most thing is not the outcomes, but we need to prepare a care plan where the woman is respected, listened and empowered. So I thought healing does not start in the operating rooms or in the medications. It starts with listening to the patients. Thank you.
Thank you. That's very, very thorough, and it sounds as if the women are seen and heard and healed. So thank you. Dr. Deepak, as someone who specializes in pain and lifestyle medicine, what patterns do you see in how women's chronic pain is often misread and mismanaged? And what frameworks do you suggest for making pain care more inclusive and truly trauma-informed?
Thank you, Shanila. I think this is something that both of you have already touched on in some ways. In the UK last year, 2024, there was a Women's and Inequalities Committee parliamentary inquiry. And the quote that you gave from there, 9 years, this is the time that it takes on average for a woman's pain to be properly diagnosed, to be heard and to be validated. And I think a lot of it comes because we are still being taught in healthcare schools to view pain from a very biomedical lens, from a lens that is exclusively focused on saying that the cause of every pain would be found by looking at some form of imaging, some form of scan, or something on a blood test, if not on a laparoscope. And I think Vindhya and I would be the first person to actually say, anybody in the audience here, do you have an idea of what is the rate of positive diagnosis when you have a look through a laparoscope for a woman's pelvic pain? Any numbers? I'll give that there. There's a 30 to 35% chance of negative, meaning a normal laparoscopy. Laparoscopies do not reveal what is the cause of pain in up to 30% of cases, which means that these patients are then called normal, and the implicit assumption then is that the woman is making up the pain, or it's stress or anxiety. And this comes from a fundamental misunderstanding of the causes of pain, of not appreciating that there are now multiple complex inputs to what forms and emerges as pain as a phenomenon. And I think until we recognize that we have been misdiagnosing and mismanaging and delaying the diagnosis because we do not understand pain, we look at it from a fixed biomedical lens, that is going to be the first of the reasons why pain often gets misdiagnosed. Secondly, there's a systemic, we've talked about in AI this morning and yesterday, the algorithmic bias, the design in research, how historically research has always excluded women, has meant that all the findings and the systems are geared to somehow thinking that whatever is commonly seen in men, which is the focus of research from the 60s to the 90s, is applicable to women. But we now understand that the neuroimmune endocrine system in women is very different. The biology is entirely different. Adversity and the reaction of the nervous and immune system to adversity is very different. Trauma, medical trauma, sexual trauma is much more common in women. And we do not appreciate all of this. We do not recognize the impact of all of this in the nervous and immune and the endocrine systems when we make decisions about women there. And it's therefore no surprise that things get delayed, symptoms do not get understood, and what is essentially a complex multi-system phenomenon tries to get simplified into something that should be resolved with a pill or a surgery every time. There's a pill for every ill, and there's a knife for every kind of pain. And I think that is something we need to move away from, knowing what we now know about the neuroscience of pain, about how it impacts. And that leads on to the frameworks. And I'll broadly say that the 3 frameworks that we need to now be viewing women's pain so that we can make a systemic difference to the whole thing is, first of all, what I would say the why. Why are we doing this? And I think that begins by the approach of a trauma-informed approach of listening, validating. Healing can start only when there's first the response of safety and being heard. And I think that is the first part there, is the attention to social determinants of health, the understanding and awareness that there are other things impacting it. The second is going to be what we are going to do. And this is where my understanding and appreciation of the lifestyle pillars, has sponsored by so many lifestyle medicine societies globally, about the 6 pillars that come through, about the role of nutrition, about the role of connection, about the role of mind-body techniques, about sleep, about physical activity. How do we bring them together to create a curated, personalized, woman-centered plan? But the third part is most important, is how do you implement this? How do you bring coaching? How do you bring behavior change? How do you meet the patient where they are? And how do you talk to the woman on what matters to them rather than thinking what's the matter with them? And I think if we can bring these 3 frameworks together, that is where we are going to get the change. And I think if we can leave a woman, as you said so rightly, Shania, feeling believed, feeling safe, and feeling heard, then I think that's where healing can happen. And really, that would be the 3 frameworks we need to bring in, and that would lead on to probably the education that's most important. In some ways, I'd probably want to, at this point, you're practicing this. You're someone with lived experience, and I think that's something so important, that when we want to think about making change in the system, we are not supposed to be thinking of some kind of innovation wherein we do something for women, but I think it's important about how we do it with them. It should be a product of co-production and co-creation. So in that spirit there, you work closely with lots of women navigating infertility, a really emotional, personal, and again, a very misunderstood problem, really. From your holistic lens, the way you approach this, what are some of the subtle ways that you've seen in fertility care, about dismissal, about being misdiagnosed or delayed? And how does your approach offer that agency and hope?
Thank you for that question. I often see women that if they have period pain, then they get offered the pill. And if they want a baby, you get offered IVF. It sounds simple, but in reality, this algorithm doesn't work. I've recently just had a lady who medically was told that she will never be a mother. Her AMH levels are 0.0. She's just told me 3 days ago that she's pregnant with her 2nd child, using my framework, which is called the 3 B's for a baby. So I'm looking at the brain, following a logical plan. And then I help the body with my physical treatments, using acupuncture, using cupping, using traditional Chinese medicine, as well as Ayurvedic, and as well as Islamic Tib medicine. I'm integrating everything that I can to help this woman. But then I'm also looking at the belief, because women, as women, we hold beliefs, we hold unworthiness, we have the fear, we also have the hurt of what's happened to us. And then we have to navigate the uncertainty. Is this really going to be a solution for me? Can this really help me achieve what I want to achieve? And this is why I like to integrate all of these systems together, because it's truly a mind, a body, and a heart. And obviously, our heart in Chinese medicine, the second heart is your womb. Your womb is, and every single person in this room has come out of a womb. Thank you very much today for listening to us. And I'd like to open the floor for any questions, please. Be nice to us.
I appreciate everything you were talking about in terms of women's health, and I'm curious, what's a better way to understand and make sure that this gaslighting stops fully and completely so we can support them?
Could you repeat the last part of the question?
What can we do as health professionals to stop the gaslighting of women once and for all?
Medical gaslighting can be prevented once we start listening to the patients. The most important thing always in women is they can't come out at a time. So you have to spend some time with the woman to try to learn her root causes, and you keep on talking to them. They will open up and they will tell what are their problems, not only physically, emotionally. Sometimes they have a stress not only at the workplace, they have a stress at the home also. So keep on talking to them. You will come to a conclusion, yes, she is suffering with this, so we can help with that. Without listening and without talking to them properly, we need to spend time with the woman. If we start spending time with the woman, we can heal them. Once, if you want to stop the gaslighting, start listening to the woman.
And also, this conversation, we have had experts, AI experts, we've got medical experts, we have the elite of healthcare system, and we are having these conversations. So invite us to the table, because we have a voice and we would like to be heard by the right ears as well. And this will also help to end the gaslighting.
Okay.
Eloquently said.
So my question links to the previous panel discussion as well. As we integrate AI into women's healthcare, how do we prevent the same biases towards pain being dismissed in women and from built into technology?
Probably take that one there in some sense, because right now some of my work is involved in looking at the challenges of AI and working with some companies in the UK leading on this stuff there. And I think the biggest problem is algorithmic bias and lack of transparency in the existing data sets that are there. A lot of the language models that are present right now still have largely Caucasian and Western data sets, with then the belief systems also that are inherent in those data sets, and the research that I talked about, which is also very much from the 60s to 90s, which have been focused on men as subjects there. I think until we start to get inclusive data sets, so the focus, the investment in research, the increase in understanding of the neuroscience of pain has to translate now into improving the quality of the data that's collected, ensure that there is inclusivity and diversity in the type of data that's collected, accounting for not just where a woman is coming from, but from the age, from ethnicity, from the hormone cycle, from across the there. And if we can get that kind of good quality data set that is built up prospectively, then that would be a true language model that you can then have some confidence, and transparency should be ensured. So I think until then, trying to use an AI model to decide on how to diagnose or screen without a human being present there would not be advisable as the data stands now.
And as a follow-up, do you think we have enough data? Do we need more clinical trials in that sense?
Yes, so there's a very interesting book that there's this, have you heard Unwell Woman by Eileen Clegon? I would encourage you to have a read of that book there. I think we do not have good enough quality data set to make really informed, accurate decisions as it stands. It is reasonable.
You mentioned that in Chinese medicine, the womb is like the second heart. And maybe a two-part question depending on how you would like to answer. Maybe explain that more in detail, or also give some more 2 or 3 concepts that are similar to that you think are important in women's health.
Thank you for asking the question. It's one of my favorite topics. The womb, so in Chinese medicine, you always have a brain and heart connection. But because the womb is actually the organ that is actually going to carry life, that is also intrinsically connected to a woman. So when we have the saying that my gut is hurting, or I know it from my gut, because you also have the connection of your stomach as well with the gut. But what's happening here is the woman has an extra resource, which is her womb. So if she is feeling anxiety in her heart, it might translate into period pains, or it might translate into something wrong also in the womb area. Even the wombs are holding emotions, the wombs are also holding hurts, even with the inner child work, even with the inherited trauma. So there are so many things that are actually integrated into the womb. The womb is essentially her own body. And as a Muslim, we believe that Allah, the higher power, He created all of us equally, and we all bear witness that He is the only one to be worshipped. And at that time, the womb spoke. The womb said, "What about me?" None of the other organs spoke on that day, but the womb spoke, because the womb is so sacred. And then Allah said that I will honor the ties of the womb, because the ties of the womb is your family, is your mother, is your father, is your siblings. How are you tied to these people? Your grandparents. You are tied by the generations of wombs. And so this is very, very intrinsic. And I've also seen that as the mindset has improved, I have found that the womb releases, and there's always been some phenomenal detoxes as well.
Thank you.
Thank you for asking that question.
Awesome conversation. I just wanted to learn this. We all talked about this aspect about mindset, and they say that on a healthy mind, you can't have a diseased body. And as Dr. Vindhya very nicely said, and Dr. Deepak, they are all from India, I wanted to learn as to how important is meditation for us to improve our inner immunity system, for us to become well. Because I, for one, believe that we are over-drugged today, thanks to the pharmaceutical promotion. But I want the panel's opinion as to how important it is for us to believe and have this conviction that our human body has all the powers to heal itself. And maybe this as Dr. Vidya Reddy said, non-surgical or even non-medicinal thing should be more advocated, or should be more popularized. Your comments?
In this lifestyle today, in this lifestyle today, where we are facing lot of challenges with the stress and sedentary lifestyle, yeah, meditation plays a real role for controlling the stress. Especially in the women, stress plays a definite role in hormonal imbalances. So when there's a hormonal imbalance, your body will not be good. Women need hormones for her to stay healthy, whether physically and emotionally and mentally. So we always advocate, as I said in my 360-degree approach, I always have this part of mental capabilities and mental stability. So I always advocate them to do meditation. See, in this era of 5Gs and cell phones, for them to concentrate, to keep eyes closed for 5 minutes is becoming very difficult. So we always ask them to sit. So we encourage them. I have my own center. We ask them to sit and keep closed your eyes for 5 minutes daily. Then slowly increase your things. Then the stress level will come down, or their hormones also start going into a good conditions where their health becomes normal. So there are not two different things. Mental should be fine with all the well-being, with no stress and all those things, along with the physical. If both the things are fine, then the woman will be very good and healthy.
So, thank you for that question there. So, I wrote a book about sort of the neuroscience of pain as we understand now, called the pain-free mindset. Now, the mindset in that itself was an acronym. While medications and interventions were sort of acceptable, I talked about the neuroscience, the diet, stress, sleep, exercise and physical activity, and therapies of mind and body. So it is about bringing that whole thing together and having a different approach to it. And in mind-body techniques, when I looked at the evidence right now for what we look at meditation and mindfulness, what are the evidence for it? It's one of the strongest evidence base for using this in pain management, specifically in women's pain as well, definitely. Because as Vindhya said, stress is a big contributor. But we are also understanding that now that when trauma, when a variety of impacts occur on a developing nervous and immune system through life and the endocrine system, especially around the perimenopausal and these times, there is significant impact. And calming the nervous and immune system using non-drug approaches with meditation or mindfulness is even enough evidence base in there. Now, mindfulness-based stress reduction, I think everybody is aware of MBSR as a technique, but now there are more advanced trauma-based approaches, taking into account things like EMDR, DBT, internal family systems techniques, emotional awareness and processing therapy, pain reprocessing. So there are now enough evidence-based techniques to say that meditation and its more Western equivalents such as mindfulness, and in fact mindfulness, when Vindhya talks about mindfulness doesn't have to be, or meditation doesn't have to be just sitting in one place counting beats. We are now talking about mindful eating, mindful movement, mindful chewing. Can you do one activity with certain consistency and flow so that your brain neural circuits just come out from their default setup into a flow? We talked about flow yesterday's panel as well, and I think we can achieve that with techniques like this, and I definitely agree. Those must be now our first options, or at least our foundational options, on which we can then layer in at the right time, at the right place, for the right patient, other standardized traditional approaches.
Thank you, Dr.
This is the last question.
Okay. Hello. Thank you so far for all of your insights. I've really been enjoying listening to all of you. My question is, my friends, I see like a lot of women around me, my friends and family, struggling with infertility, and it seems to be something that is more common than not now. And I'm wondering, what are the biggest causes of infertility? One of the ones I've noticed is cortisol levels, feeling stressed. Is there something around that, and is there anything else that's causing more and more women to struggle in this area?
Shall I go? Okay. Thank you for your question. And that is true, because when cortisol levels rise, then hormonally your estrogen levels rise. And when estrogen levels rise, in order for ovulation to take place, your LH, luteinizing hormone, has to overcome your estrogen levels. So if your estrogen levels are naturally high, the LH levels have to work harder in order to achieve ovulation. So that's a direct answer, or a direct correlation to stress and infertility. And then we also have to take into account that we have very stressful lifestyle. We have our eating habits are not the best. and we have lots and lots of people that are basically also, they are planning for children later in life. So that's also a factor in infertility. But it is really important to help with your stress levels, and this is also what I actually I address this in my fertility program as well.
Causes. Hello. I just want to add one point to her. Stress even reduces your egg qualities. Once the quality of the egg, not only egg quality, it reduces the sperm qualities also. So if the egg quality is low, the infertility rate will be very high. As she spoke initially about the AMH levels, yes, AMH level shows us the how many quantity of the eggs we have, but it does not tell you about the quality of the eggs. So quantity does not be equal to the quality of the egg. So the stress plays a major role in the quality of the egg. And the quantity also reduces very fastly. As a woman, we have at the birth around 40,000 eggs, but year by year it reduces fastly. But if you are very stressful, the loss of the egg will be very, very fast. So it goes in a very rapid action. That even reduces the quality of the egg. That is the reason nowadays we are seeing many infertility because of the lifestyle stress which we are facing. The egg quality and quantity are reducing. But the quality is the most thing which is get affected. If your AMH is low also, if your lifestyle changes happen, you are healthy, you are stress-free, yeah, there is a chance of you becoming mother. As she said previously, the patient has conceived on her own with AMH low because she has improved herself the egg quality. That is the most important thing.
I have a question that is at the intersection of opioids and pain. So we know that opioids are one of the most effective ways to treat pain post-surgical, and in fact, in some people, that leads to a severe form of addiction and ultimately the opioid crisis that we have all seen. So my question relates to how this differs between men and women at different stages in their life, particularly when hormonal changes in women occur, in different aspects of their life as estrogen levels change. I don't know much about that. If any of you could explain that, would be lovely.
Should I go? Yeah. So yeah, and thank you for that question there. So opioids in general are at a dosage dependent reduction in hormone output, and especially hypothalamic and pituitary level suppression is a major factor. HPA axis suppression is a major biological factor as you increase your opioid dosage. Now, two parts to your question there. One, of course, in acute pain, nobody denies that opioids are fantastic, but in chronic pain or when there is chronicity beyond 3 to 6 months, we do not have any good quality studies at all that suggest that opioids are useful for the large parts of the population in the longer term, which is why they've fallen out of favor, which is why the evidence has come out from the US and from Western Europe that actually opioids cause more harm. And indeed now, even in post-surgery in the United Kingdom, we've issued a recommendation from the MHRA, which is our regulatory agency, saying that even post-surgical, long-acting opioids must not be given at the time of discharge from hospital for patients having undergone surgery there as well. We've realized that long-acting opioids are most addictive and most problematic. The real problem comes with the second part of the question that you asked is how is hormonal change occurred?
Yeah.
Now that is something that as far as the research goes, again, due to the fact that traditional opioid models and research in animals have been done on male animal models during the 70s to 80s. So the research that we have on how it changes has not really taken into account menstrual cycle changes, period changes, and menopausal variations. So what I've given you is a high-level overview that increasing doses of opioids suppress the HPA axis, causing a global reduction in all hormones. So as women come into the perimenopause, where there is unpredictability and instability in estrogen and progesterone levels and testosterone levels, this is going to cause a unpredictable change in their nociceptive apparatus. Estrogen especially has got a pro-nociceptive tendency, meaning that perimenopausally as well as postmenopausally, women are more prone to experiencing pain that is driven by a hormone sensitizing and upregulating a number of receptors throughout the entire nervous system. And these changes and upregulation in those receptors are not opioid sensitive at all. They do not respond well to opioids, and in those patients we have to be quite careful. So this kind of pain is called central sensitization or nociplastic pain, and opioids are definitely not recommended for this kind of pain. The most common examples you would see of this pain are those that are seen in fibromyalgia. 80 to 90% of endometriosis patients have got that kind of change in nociplastic, and all the pain that you see with long COVID, chronic fatigue, Ehlers-Danlos, all of these are women-centered problems.
That was such a great answer, because we are addressing women's health. I speak at 1:30, but we're using human models, not mice, as you were talking about. And so it is beautiful guidance for how we will do our science using your clinical experience and many of the things you stated. Thank you.
Thank you so much, everyone, and a great panel of discussion. Sorry, sir, you can meet them after the panel is over around. They'll be available for any questions. Sorry, before you go, I have a small question for this. This was a very interesting panel for me as well. I just want to understand, when we talk about stress, so wasn't stress back in the day when our mothers were conceiving, and they went through much more stress than us, I feel. So why we talk about miscarriages now, why we talk about IVFs now? Just one question. I was very curious throughout the session. Yes. Okay. So I'm gonna spot all three of you outside, and I'm gonna I need this answer, that why we talk about stress and why we talk about therapies right now, but not before.
Yeah, I had a talk, and my opening line was that our grandmothers were more fertile in their 40s and 50s than we are in our 20s and 30s. And the reason why is because our mothers, they might have had stress, but they also didn't have this.
Phones.
They didn't have this pressure of outside models, of keeping up with the Joneses, of having the perfect Instagram picture.
That's right.
And also, as women, we were just meant to get married and
That's
have
right.
children.
That's right.
But now we want careers. We want to be business ladies. We don't want to just be tied to the kitchen sink, which I think is a good thing. But then we also, there's
Want
always
to do more than that.
Yeah, there's always a price to pay, because we do need to nurture ourselves and go into our feminine energy and not stay in our masculine energy state. A very quick answer, that is.
Thank you so much. Everything comes with a cost. That's what you said. Right. Thank you so much. Thank you so much. A round of applause for a great panel once again. I request you to please stay back for a picture. Thank you. Thank you once again. Exit from that side. It's too congested. All right, let's move on. That brings us to the next keynote speaker. Our next keynote speaker looks like a breakthrough direction in cancer treatment, one that moves past the limitations of traditional chemotherapy and opens the door to safer and more precise generation of immunotherapies. It's an emerging approach with major scientific promise and significant implications for global biotech investment. This keynote is titled as Beyond Chemotherapy, PLPC-DB, as a new de-risked non-cellular immunotherapy asset class in global biotech's investment. Allow me to please welcome with a round of applause Dr. Raymond Sandoval, Chief Scientific Officer at OGRD Alliance. Are you here? Yes. A round of applause for our next keynote speaker. The stage is yours. Check. Testing. Test 1 2 3 check.
Hello, hello, hello. Listen, feel. Testing, testing. Here? Testing. Okay.
Check test 1 2 3 check.
Okay, let's go. I need the first. I need the first. This is the first. Yes. Yes. Thanks so much. Okay. Thanks for your attention. Today I present PLPC platform. But first of all, what is the scope? What's our scientific pipeline in 2025? In this year, we have 4 works presented in ASCO, American Society of Clinical Oncology, and 2 works in ISMO, European Society of Medical Oncology, and 3 works in Society of Immunotherapy in Cancer, San Diego, California, in March, and 3 works in Orlando, September, in CAP25, College of American Pathology, 5 papers, Q1 peer-reviewed, published, 4 books available in Amazon, 3 family patents present across 3 continents these years, and 2 external validated audits from Fryer and Veristat about to pre-FDA access. But what is PLPC? PLPC is a platform with 3 modules. We have PLPC-DB, dendritic based, that is DB, personalized cancer immunotherapy, NX, vertical, 4 lines. STIP is our backbone regulatory. In PLPC NX, we have 2 areas, Terra support for T defense and Regenera, and wellness for Vitalis and sport. How works PLPC? PLPC uses a new language. If you see the immune system, some therapies get believed about you can treatment with a cell or with a molecule, but in reality, the difference is that the immune system is all new language. For me, excuse me? Okay, perfect. Thank you. Okay, more? Thank you. For many years, the immune system, so body could only attack or defend, you know? But into the immune system, use multiple molecules and signals to correct and reprogram the without damage. Immunotherapy has evolved throughout a century from Dr. Virchow to Steinman, and we have many papers and books, thousands in reality, but very few really treatments reach to the patients. PLPC is not a concept, it's not a startup, it's the apex of the entire. Testing. Perfect. This is better. So immunotherapy from Dr. Birkhoff to Steinman evolved throughout the century. And PLPC is not a trend, not a concept, not a startup, not a new project, not an idea. It's the apex of the entire journey. It's a mature synthesis, you know? The Nobel Prize. In 2011, the Nobel Prize goes to Dr. Steinman, Butler, and Hoffman because they showed how the immune system really works, what to attack, and what to tolerate. And they discovered the adaptive immunity, you know, the gateway of tolerant receptors and dendritic cells, starting from our skin. This is a new logic. PLPC represents a new logic. For decades, we tried to replace the cell, CAR-T, or inhibit them, checkpoint inhibitors, anti-PD-1, anti-CTLA-4, for example, or force them, many cytokines, EL2, EL10, anyway. But they all share the same weakness, dependent on unpredictable living biology. This is the problem with CAR-T, this is the problem with dendritic cell, this is the problem with stem cell therapies. So PLPC is different because it's a structural therapy, not depend of living biology. Later we see about structural immunotherapy. The skin. The skin is the gateway, is where the immune response starts. You know, let me see. In the skin, you can see the dendritic cells, a special kind of these cells, Langerhans cells. And this Langerhans cell or dendritic cell get the message, sense what happened on the surface, and translate the message to the immune system in the deep layers. So PLPC use the same route of this natural message. PLPC follows speaking the signaling language of the dendritic cell with a minimal intradermal application. The PLPC works with an antigen presenting system. In this system, the dendritic cells get the antigen and put some parts in the surface, and these parts connect with helper T cell that allows connect with killer T cells. And killer T cells destroy cancer cells, infectious bacteria, virus, anyway. So the PLPC follow the function about dendritic cell and T cell because we brings harmony to the immune system with Th17, Th1, with for defense, with balance, Th2 for cooperation, and with Tregs. So with that way, we get a given functional equilibrium. What happens if we combine molecules or signal from DBT, dendritic-based therapy, with conventional therapies in cancer, chemotherapy, radiotherapy, checkpoint inhibitors? What happens? For example, many studies show us that when you combine chemotherapy with dendritic-based therapy, chemotherapy efficacy rise up to 50%, and side effects fall 40%. So anorexia, for example, 53 combined therapy versus 96. Leukopenia, 43 versus 80%. Abnormal liver function, 41% versus 70%. This is a big difference. And how is possible? Because PLPC support 5 mechanisms. First, antigen presentation, so increase tumor recognition. Co-stimulation with signal CD40, 80, 86, so increase immune efficiency. Increase synergy with chemotherapy through Th1 cytokine release. Treg modulation, restore anti-tumor immunity, and immune memory, so decrease the recurrence. 5 mechanisms to improve the efficacy of chemotherapy. Radiotherapy is a local treatment, but under DBT, under PLPC, we have abscopal effect. And how is that? Dendritic cells capture antigens when local radiation release from the tumoral lesions. And these T cells activate CD8 in the lymph node, present these molecules to and attack distant tumors. So this is the way that local therapy becomes a systemic immune response. All knows that the cancer builds its own ecosystem, silencing lymphocytes, deprogramming defense. So PLPC is a restored functional dialogue. If you see, excuse me, no. If you see, the immune system have multiple moleculars and cells. So when we use checkpoint inhibitors, one molecule, or CAR-T, one cell, we fight against all the entire platform. For that reason, if you use checkpoint, you can repair or use one key. But if you use a platform like PLPC, you can reset the entire cable. You know, this is the difference. For example, you can see the curve response, usual in the checkpoint inhibitors. In the green bar, in the third graphic, you can see the difference when you use DBT, dendritic based therapy, like a warm-up, some weeks before the treatment with checkpoint inhibitors. And in the last graphic, you can see the effect when you use at the same time dendritic based therapy with checkpoint inhibitors. So you can get higher efficacy and longer lasting outcomes over time. Quick comparison. Drugs, a strong response but frequent adverse events. Exosomes, weak response with few adverse events. And PLPC, a strong, durable response with minimal adverse events. The main profile is zero toxicity. For that reason, this kind of immunotherapy is for all stages in cancer. In each type of cancer is personalized with no systemic toxicity and synergist with any therapy of conventional treatment. This is how we move from chemo units or surgery rooms or radiotherapy units to the safe, minimal, at-home application. Don't need the environment of hospitalization, even without leukapheresis or intravenous immunotherapy, that the older kind of immunotherapies in cancer. Remember that concept? This is very, very famous. Multiple tools in just in one device. Few believe it than the beginning. PLPC follows the same route. Many benefits in just one therapy. Release cytokines in order, like chemotherapy, synergist, radiotherapy with abscopal effect, and surgery, removal, residual implant, thanks to the immune memory. This is the whole sequence. Very simple, the show. We get a liquid of cells, PBMC, peripheral blood mononuclear cells, and we generate a cell culture enriched by tumor neoantigens. So in this step, we get the secretome, and the secretome we proceed to centrifugation, concentration, lyophilization, and finally administration application intradermal, minimally invasive. So this is simple, but behind that slide, maybe 240 protocols, and each protocol with 30 or 40 drafts before. So this is not a rocket, this is entire NASA, you know. This is the behind. And let's see the tumor antigen, because yesterday after the panel I received some questions. This is the special step, tumor neoantigen, because if we replace tumor neoantigen for example, senescence molecules, we can get immunotherapy for anti-aging purpose. If we replace tumor antigens for a special profile of cytokines, we can get a tolerogenic immunotherapy for autoimmune disease, for example, to transplant, reject transplant. And that is not an unpredictable, not is random biology, because we have very consistent markers, CD25, 40, 69, 86, IL-10, in our profile of cytokines and interleukins, and our proteomic spectra reveal multiple protein platforms, main 5 blocks of 20 protein each. So it's a reproducible, very precise biological identity. From the real-world evidence, after more than 3,000 patients across 11 years, we have many data that to process. But for example, PAT with 18 FDG, up to 80% reduction in hypermetabolic activity after 45, 60 days approximately, with 0 systemic toxicity. This is the how it goes on after. What is the scope to the registration in some agencies, regulatory agencies? For example, in USA, FDA expanded access 3 months. Mohab, 3 months compassion use. And Singapore, HSA, for special access route, under 3 months. But this is the immediately registered, because if you get a formal, finally, registration, more than 12 and 34 months, because it's a new way, not the 10 years, nor the $500 million like a normal or conventional drug, because use the special way. We can see later. The real-world evidence and plus STIP provide us animal-free stage, phase 1 to 3 free. Later we see how it's possible, and lower cost and shorter timeline to registration. For that reason, many people consider that PLPC platform or other like that, there is very non-pharmacodynamic treatment at this moment. Like an advanced secretome platform may be the first in class. This is a quick summary. Best entry value, 0 toxicity, lower risk, and the better stability profile score to the entry. The second pillar of this platform is STIP. STIP is a structural traceability and immunophenotypic platform. It's a regulatory backbone. It's that the make the magician is possible. You know, STIP allows us human ex vivo evidence engine, also CTD 5.3 documents generator. All of that, NAA, new approach methodology, aligned and compatible with Part 11 digital traceability. For that reason, STIP allows us formally eliminate animal studies. This is from FDI Act Modernization 2.0 from 2022. And the new approach methodologies does not bypass phase 1 to 3, replace them, but with equivalent data, but faster, safer, cheaper, and more accurate. It's a new way to get evidence. STIP belongs to the third type of the NID FDA, ex vivo models. Other type of new approach methodologies are organoids, organoids on chip, and silico simulation. So in that way, STIP get data that converge in module 5.3 for biomarkers and traceability integration. This is the way that the bridge between science and approval. But the STIP is not optional for the PLPC. It's the only way path, you know, for non-pharmacodynamic treatment, because PLPC has no PD, no dose response curve, no clearance kinetic, and it's structural, no pharmacological. You don't have a systemic circulation or a plasmatic concentration or levels. You don't have this because it's structural. You apply intradermal molecules, and these molecules is absorbed, assimilate with the membrane cell in the cells, and start the new work, the new terrain to the chemotherapy, radiotherapy are really functional. The timeline with STIP is more shorter. In the right side, you can see the difference between traditional path but STIP pathway. How is shorter the timeline. Animal studies 1-2 years and replace it, almost instant. Phase 1 more than 40 hours because it's a study with different lines. Okay, perfect. And phase 2, 1 to 3 years, and phase 3, 3 and 7 years is replaced by matrix, so it's more shorter. The applications of TIP in the industry is multiple. Biopharma, phase equivalent validation, accelerated non-pharmacodynamic pathways for nutraceutical, get first a mechanistic proof of function, diagnosis, structural biomarker validation for CROs, traceable ex vivo validation, and sovereign agency, a modernization of the regulatory programs. This is very, very interesting because STIP get more than 20 parameters are similar with Nash game theory. Analysis unit, traceability, convergence, input, function, and centralization, and 25 more. This is the flash, better evaluation, shorter timelines, faster process, regulatory cost savings, and full regulatory compliance to any jurisdiction across the world. And finally, the NX. NX is a 4 lines, T-Defense, Regeneron, Vitalis, and Sport. The main characteristic is only requires notification because all components is fully GRAS certified, so don't need studies for any molecular or any component. We work with 6 axes, and with this axis of composition, we get different purpose, different benefits for different markets. You know, Regeneron is for autoimmune and inflammatory chronic disease, Vitalis for anti-aging or senolytic purpose, Sport for a high performance and faster recover, and T-Defense for anti-tumoral purpose. And this is the axis, this is the backbone algorithm. We use adaptogen of neuroimmune, liposomal matrix, immune modulator, symbiotics, redox bioactives, and long-chain lipids. PLPC is the first, maybe the only, maybe the last nutraceutical with a validation ex vivo, because work with STIP. So this is the profile that we get when, in ex vivo validation with any of the lines. And the final summary, it's a traceable cellular metabolic effectiveness with a strategic modulation. It's not the same benefit. It's different in any patient, and some moleculars increase and some moleculars decrease. So you get the real profile that the patient needed. Best comparative position over the supplements, over nutraceuticals, over functional foods, and with full globally regulatory compliance. So at the end, what is the entry to this platform asset? It's very clean because the legal due diligence is pre-aligned with important legal firms across the world. The financial is very clean because it's through new companies for each asset in this platform. And scientific due diligence is open access. It's already done, published in papers and books. So at this moment, I think that maybe in the past, many investors or companies that develop a product or service like that committed far more for far less on the table, you know. But PLPC is different because it's not a concept, it's a service, a product, a platform with 11 years of history. And I think that is the unique moment to lead the next area on global immunotherapy, but first in class in structural immunotherapy. Thanks so much. Very well. Okay. Sure.
Thanks, it's a detailed presentation. I have a small question with reference to cancers like glioblastoma. As you are aware that it will grow in more immunosuppressive environments like brain. So how successful is this in terms of dealing such types of cancers? Number one. And the follow-up question is like, basically any cancer survives on 2 basic things. One is protein and other is sugar. Will this also impact the pathways of that environment where the cells get starved?
Okay, the first question is glioblastoma and central nervous tumor. We have many results and very successful. Why is the difference with PLPC? That PLPC is molecules, so the hematoencephalic barrier is not a problem if you use cells. This is one first. Second, the mechanistic about PLPC is reprogramming the microenvironment of tumor. So this is very benefit when you have a patient after radiotherapy, after surgery, after chemotherapy, with true edema, with true inflammation in the tissues, and you need corticoids to treat this, but you decrease the defense and you put the patient in a chronic position inflammation, you know? For that reason, in this kind of tumor is very notorious the benefits in the reduction, decrease the damage in the tissues because respond very fast the process non-tumoral, inflammation, edema, congestion, anyway, you know. For that reason we have very interesting results, and all these results today it's available like video testimonials in Oncovix program in Latin America, Chile, special, with video testimonials from directly from the patient, with all the data, obviously that clinical quality with the patient, with the testimonial, the patient relates how is the change across the evolution with this treatment and the difference with receive the conventional treatment and we add, because PLPC not replace any conventional treatment, it's just a plus to permit that the conventional treatments get a more functional terrain to work, you know?
Oh, great. And is it the same when it comes to sarcomas and some deadly cancers like pancreatic cancers?
It's very important because sarcomas is more young people, and these people is more fragile, and we need to keep more focus and care other circumstances, fertility and another sequence about after the treatment, you know. So in treatment, in sarcoma Ewing and others, we have very results because the radiotherapy increase the effectivity thanks to abscopal effect. So not just only in the main lesion, if not other in the multiple lesions, that's gonna disappear after 2 or 3 months, more or less.
Okay, so I think it's more evolving, and I think we can see some good results in future when
yes,
it's implemented. Okay. To my second question, when I asked first about the sugar and protein. Shall I repeat it?
Okay.
Okay, that's fine.
Oh yeah, I continue.
Checker will catch up.
Aftermarket. Sure.
Definitely. Thank you.
I don't want to be cruel, but I'm so sorry on this, but we are really running on time. And I don't want to take away your lunch break because we have been focusing a lot on such great topics, so we need to fill our tummy as well with good food, right? So moving on to the most important part of this conference we have been here together for is we'll be celebrating the leaders, as we also like to call them, the change makers, driving the innovation and setting the new standards in the healthcare industry. Awards like these are more than just plaques or certificates. These are reminders that change is being made right now with the right set of people. And it's through their persistence and passion we are able to do so, and the industry keeps moving forward. So thank you once again to everyone present here who's making a change. And with that, I would like to welcome with gratitude and celebration, allow me to welcome Ms. Malira Barbara Coop from Leela Quantum to do the awards felicitation. It's an honor to have you, ma'am, here. Thank you so much. So in the category, of course, of Excellence Healthcare Award, our first awardee is Dr. Meera Sadeh White. I would like to welcome her on the stage, and a little bit about her before she steps up. She is a founder and managing director of the Wellbeing Center Middle East, a doctor of mind and body medicine specializing in integrative mental health and integrative cancer therapies. She's trained at Saybrook University at the Icahn School of Medicine in the Mount Sinai, New York. Dr. Sadeh is the author of First Time Parent Expecting Better. Congratulations to you, ma'am. request you to please stay back, ma'am, please. So she's going to do a quick presentation.
Hello, everyone. Is my voice clear? Perfect. What an honor. Wow, I love it. You know, a bit about me. When I founded Wellbeing Center Middle East, I started in Beirut, in Lebanon. So I'm originally Lebanese. I'm married to an American. So basically, yeah, I'm waiting for the slide. I started it, my path started in the American University of Beirut of Healthcare in 2003. You know, I'm very excited. Traditional medicine is #1. And then something very interesting happened to me. I started having tachycardia, you know, fast heartbeat. I went to see the top doctors we have there, cardiologists, electrophysiologists, endocrinologists. And they will tell me, Mirna, there's nothing wrong with you. You know, all your tests are coming out normal. Okay, so why do I have the tachycardia? Why am I breathless? Why do I feel what I feel? And no one shed light on my lifestyle. No one asked me a question about my stress levels, about sleep hours. What am I eating? What am I putting in my body? Am I breathing? Am I pausing? Am I meditating? Am I happy? No one asked me any of this. So of course, now knowing what I know, my knowledge tells me that I had burnout, right? I did not have any balance in my life, and I was working, right? And why do we work? We want the approval of others, or we want other people, our parents, to be proud of us, right? But what about our well-being? What about our self-care? So from here, Wellbeing Center Middle East was born, and now I'm very much into, you know, women's health, fertility, what you were talking about, and how stress affects us. Everything that is integrative, you know, mind-body medicine, integrative mental health, integrative oncology treatments. And I recently authored a book, First Time Parent Expecting Better, where it's really amazing. I talk about a lot of Ayurveda, a lot of, you know, self-help tools are there, and medicine as well, which is always a great foundation to have. So I've learned that for us to be well, we need, of course, physical health, but physical health alone is nothing. Mental health, emotional health, spiritual health are definitely much more important. So I'm so happy to connect with all of you here today, and I will be having a panel in a few hours after lunch, after our tummies are full. And I will be also on the booth of Authority Publishing. Special thanks to my mentors, to my family, to my daughter Freya, who inspired me to write this book as well. And please come meet me, and I'll be very happy to meet you too as well. Thank you so much for this wonderful award. Thank you.
Thank you so much, ma'am. Moving on to our next Excellence Awardee. I would like to welcome Alia Al-Nasser. So Ali Nasser, a little bit about him before he steps up on the stage. He's an Excellence Awardee. He's a manager at Maltese Apitalk, a pharmacist since 2008, and he has gained experience across pharmaceutical dispensing, laboratory diagnostics, pharmaceutical marketing, and despite all the further challenges he's gone through, he studies further to fulfill the requirements, and he practices currently in Germany. Not to forget, he also owns a pharmacy, and he is planning to expand and develop his pharmacy business in the future.
Hello? Yeah. Thank you very much. And thank you from the heart for this wonderful honor. This recognition means a lot to me. This conference in my work. Thank you very much.
Thank you once again. Moving on to our next Excellence Awardee. I would like to welcome with a round of applause Engineer Ahmed Abdul Qadir on the stage, please. Before he steps up on the stage, a little bit about him. He's the co-founder and the CTO of Diagnostics, Elite Medical Company, which is in Saudi Arabia's first fully licensed teleradiology provider under his leadership. He also has a diagnostics in elite transformed radiology care with end-to-end PACs, RIS deployments, and AI-driven triage. As a founder of HCIT Professionals, he leverages with about 17 plus years of experience in the system integration and application development. A round of applause once again. Sir, would you like to say a few words?
Thank you very much, everyone. Thank you for hosting me here. So it's like a great pleasure to be like one of the the honorary awards. I would like to say thank you to everyone, like to my family, to my father, to my sisters, like to my wife, to everyone. Like thank you very much for hosting me here. It's a great honor. Thank you.
Moving on to the next Excellence Awardee. I would like to welcome with a round of applause Dr. Med Anna, again in the Excellence Health Awardee category. Before she steps up on the stage, Dr. Anna is the Chief Medical Officer at MBST and is also an Associate Professor at the University of Tübingen, a board-certified orthopedic and trauma surgeon. Her focus includes musculoskeletal health, bone regeneration, osteoarthritis, and sport injuries. She applies both surgical and conservative combination therapies, including NMRT.
Thank you very much for being recognized as some kind of a trailblazing person in the field of regenerative medicine. So yeah, MBST I think is a cutting edge technology which hopefully will be accessible for patients all over the world. So modern medicine can be lived and perceived by every patient. Thank you very much.
Thank you. Moving on to the next Excellence Awardee, of course, Dr. Arvapalli Kaushik. Can I please have you on the stage? He is a chief radiologist and the director of radiology at Focus Diagnostics. He is actively engaged in the acquisition and expansion of diagnostic centers across India, combining clinical excellence and strategic leadership. He's deeply passionate about pioneering the integration of technology and, of course, AI, as we spoke about today, into radiology to enhance accuracy and patient outcomes.
Thank you very much for having me today and for this award. I sincerely thank Health 2.0 conference organizers and my wife here, Rohini, and my family who supported me all this way, and thank you very much. So I started my career as a radiologist, and I still work as a radiologist. I learn day to day. I recently passed EDIR and other national exams in the radiology, and I continue to do, I work now as a radiologist in the day to day, and also be in the operations, acquire new diagnostic centers. As of today, we started with a one center, and today we are around 14 centers in India. And we still want to continue the acquisitions and expand the radiology across the nation. Thank you.
Thank you so much, sir. Moving on to the next excellence awardee in the same category. We'd like to welcome with a round of applause Azad M. Ali on the stage, please. He is the Head of Manager of Continuous Medical Education and Professional Development at King Faisal Specialist Hospital and Research Center in Jeddah. Leveraging for about 20 plus years of experience, holding a master's from University of Pennsylvania and fellowship from the Cleveland Clinic, he leads initiatives that enhances healthcare professional skills. He received multiple awards from the Saudi Commission for health specialities for excellence in continuous professional development. Congratulations to you, sir.
Thank you very much for this prestigious award. Coming from education and training in healthcare, and taking this award give me the glimpse that we are on the right track. Always like to say that we are here, all of us, for our patients. Even education and training, we are serving patients by empowering caregivers who are taking care of them. Once again, thank you very much for the award.
All right, moving on to our next awardee. I would like to welcome with a round of applause Samira Sajdev. Samira Sajdev is a founder of Innover Mind. She's a founder of Innover Mind, is a psychologist and a researcher passionate about women's emotional health. She is the recipient of Sardar Patel Award for Health Innovation, recognizing her work in creating frameworks that go beyond conventional science. She has invented a program design methodology and has solved 3 programs in women health. That's a loud cheer. Internal family systems, creating love, a study and healing methodology for relation, intelligence and resilience. A neuroscientific study and methodology, you can stay back, ma'am, for better life in reproductive women health. So, over to you, Ms. Samira. You have done some great work for women, and could you please elaborate a little bit on it? You have some tears in your eyes as well.
Oh, yeah. my team back in India and Philippines would be very happy. And so would be the people who got impacted, I'm sure. Just want to thank you all. This has been such an empowering experience for me. I've learned a lot. There have been so many learned and more experienced people in this room. I don't stand a chance, yeah. But I just wanted to really encourage, invite, and ask people to be here in my talk tomorrow, where I actually talk about my whatever I've been awarded for, and sort of take your inputs and grow further in terms of how I impact people. Thank you so much.
Thank you so much, ma'am. Thank you so much for contributing back to the society and everyone present in the room. Moving on to the next awardee, Dr. B. Srinivas. Can I expect you on the stage, please? Dr. B. Srinivas, are you in the room? All right, I think we can award him after the lunch break if he's around. Thank you so much. And congratulations for the award. If anyone is here to collect his award. All right, moving on to the next awardee, Dr. Baisa Hermath, again in the same category of excellency. He is the CEO of NOFH leveraging with 25 plus years of experience in the IT, which is Infosys and Cisco, with 13 plus years of experience in agriculture. He's been recognized as the most innovative agri-entrepreneur. Okay. All right. So congratulations, sir, Dr. Basaya Hermath. With a great experience, 25 plus of experience and 13 plus of experience in agriculture as well. He's recognized with the innovative of agri-entrepreneur. So would you like to say a few words, please?
Thank you. Thank you for the award. All this credit goes to the Indian farmers who are doing organic farming and the government of Karnataka who adopted our miracle tree moringa for the nutritional deficiency for the children's as well as for the pregnant and delivered mothers. Today we are talking about a lot of nutritional issues which is causing the lot of PCOD problem and all those things. But I work on the rural India for the malnutrition eradication, and thank you for this recognition. Thank you.
Thank you so much once again. Moving on again to the next awardee. Let me welcome you once again with a round of applause. Mr. Baston. Mr. Baston is a sales and partnership manager at GetSteps. Are you around, sir? Okay. He combines his technical expertise as a certified orthopedic shoemaker with entrepreneurial thinking. Fantastic. His analytic approach prioritizes uncovering root causes. Leveraging his medical knowledge and craftsmanship, he contributes significantly to the development of the society. Congratulations, sir.
Yeah, thank you for all being here. I didn't really prepare any words, but I think I need to mention that everyone sitting here, working as a healthcare professional, we do need endurance and sometimes resilience, as we talked about in the morning today. So sitting here means we're on the right track, providing better healthcare for the people in every country of this world, and I'm really proud being a part of this. So thank you for being here.
Thank you so much. Moving on to our next excellence awardee. Let me allow you to welcome with a round of applause Mr. Bhaskar Shrihati. Mr. Bhaskar Shrihati. Yes. So he is the head of nursing services at the Apollo Health. Is he around? I got confused. It's Mr. Bhaskar. Okay, no problem. But he comes with a very great experience of holding 22 fertility centers and 520 primary health clinics across the world. So hopefully we'll be awarding him after the lunch if he's around. Moving on to the next awardee we have in the category of Visionaries Award. And it goes to Brian J. Mr. Brian, are you around? That's right. Okay, Mr. Brian is a founder and executive director of Abundance Foundation, and he is certified addiction specialist and a TEDx speaker. So you're going to give me a nice 5-minute speech now. Who's recovering his journey, inspired his mission, his foundation exemplifies his strategy, offering long-term recovery support, from housing to community, showing how these strategies transform lives.
What do you want to talk about? No, thank you, Health 2.0, for having me here. It was great to be able to bring my team out this year and kind of see everything that's going on around the globe and the different cultures and how we're in such a little bubble in America. We're in our little zone, and so to be able to get out here is really impressive. But all the work that we're doing is just because I have a really great team. It's taken a long time to build the team, and we've had to go through significant ups and downs in that process, but because of the team is how we're able to provide such great services to our people. So.
Thank you so much, sir. All right. With that, moving on to the Excellence Awardee, of course, in the healthcare category. Let's welcome Claudia. Miss Claudia on the stage. A round of applause for you. She is the founder and CEO of Spark, at a top 10 mental health services in Europe. With nearly 30 years of experience, she combines her expertise as a psychotherapist and RTT hypnotherapist. Spark offers services in 12 languages, including Arabic, and easily scalable.
Thank you. Wow. Not prepared at all, but totally grateful. And I would like to say thank you to my family, especially to my daughter, because you know, whenever I learned or educated, trained myself, she was there and she didn't leave me. So thank you for that. It's totally inspiring for me being here today. And you know, I'm a mental health passionate, and I really hope that the corporate world gets more of it, that the leaders are mental resilient, and we can just outperform together. Thank you so much.
Thank you so much, ma'am. Moving on to our next awardee in the category of Healthcare Award. Let's welcome Dr. Deepak Ravindra once again on the stage. He is the director of Berkshire Center for Pain and Lifestyle Medicine, bringing over 20 years of clinical experience in the NHS. Leveraging his expertise, he established and led the award-winning NHS iPass and Berkshire Long COVID Integrated Service. He's also an author of The Pain-Free Mindset. He's also known as the healthcare leader, and he runs a YouTube channel as well. Don't forget to subscribe. And Dr. Ravindra is known for translating complex science into accessible care. Sir, some words? He was one of the panelists as well for today, just in case.
Thank you so much to the organizers of the Health 2.0, and thank you for a wonderful, inspirational day one today and definitely tomorrow as well. I look forward to it. This award is recognition, and I must thank a lot for my team, my colleagues, my mentors, my family, especially my wife, who's given me the permission to come out here, while in the UK it's still 10 degrees. But most importantly, this is to all my patients, because their stories shaped the way I think about and practice pain medicine now. And we see how much that healing can start when there's listening, when there's compassion, and when there's trauma-informed care. And this award is, I feel, a recognition for that kind of work that I've been spearheading in the UK. Thank you.
Thank you. All right, moving on again in the same category of Excellence Healthcare Award. Let's welcome Dr. Dor Crusher. All right, seems like not around. He's around, okay. All right, round of applause for him. He is a physician and a healthcare innovator. He's also the CEO and founder of CureMe. With a background of ophthalmology, he created this to give healthcare professionals a space to share knowledge, grow, and work efficiently. He's also passionate about helping doctors thrive ethically, sustainably with the changing industry. He also believes that patience over profit can lead to professionals. I hope I'm pronouncing your name right. That's right, Dr. Dor. Is that Matei, Dr.
So, yeah, thanks. I didn't actually know how to hold a speech as well. So I'll do it really quick. Thanks, Health 2.0, for finding me online and inviting me. It's quite a surprise. But the biggest thanks actually goes out to my wife for putting up with me for the last 12 years, and my kids, and I hope she hasn't actually filed the divorce papers. But the biggest thanks also goes out actually to my biggest asset in my professional life, which is undoubtedly is my team, is the nurses that I had, the technicians that helped, the lab assistants, and everyone else that helped me work as a doctor and succeed. And every single one of our practices, which are down to one now, manage to treat around 10,000 patients a year, conservatively look, check up, and do therapy with a high intensity quality level. And I don't think I could have done that without everyone else. So thank you to everyone, but still starting with my wife first.
Thank you so much. All the gentlemen in the room thanking their wife are the best right now. All right, moving on to our next awardee in the category of Young Achiever Award. Her name is Ellen Al-Jamal. I hope I'm getting your name right. Yes. So let's welcome her with a round of applause. She is a high school student from King Abdulaziz and his Companions Foundation for Giftedness and Creativity. Despite her young age, she's already conducted innovative research in applications of biomedicine, nanoparticles for treating brain tumors. Fantastic. And also beyond that, she has shadowed surgeons and volunteered with the Saudi Ministry of Health. Congratulations.
So yes, as you heard, I'm a high school student. A high school student who's 17 years old, conducted research in biomedicine, nanotechnologies, and immunotherapy. I've heard that panel of immunotherapy. That was my exact same idea. And I've shadowed surgeries in 4 departments, in surgical departments containing neurosurgery, obgyn, and pedo. So, a special thank you to my mother, Dr. Amal Imam, for her standing with me. Thank you so much. All of this was because of her. When I was 3 years old, she used to study medicine. I was under her desk. My mother had me at 18, by the way. She studied medicine. So that really influenced me. That really started up my journey. So, a special thank you to you. Thank you, Mama. Okay.
Thank you so much, dear. Thank you. Moving on to the next awardee in the category of Excellence in Healthcare. Let's welcome Dr. Dr. Francisco Martinez. Let's welcome him on the stage, please. Are you around, sir? Yes, wave back to you. He is a physician entrepreneur with about 20 years of experience and is also Chief Medical Officer of Tiara Health, a leading longevity and age management clinic in Marbella. He combines advanced diagnostics with personalized science-based therapies. He's also the visionary behind Lily Bee, a premium health brand dedicated to optimal living and developing innovative models that integrate luxury and precision health.
Thank you so much. I want to thank the conference for your hosting. You have been amazing. And I just wanted to say that I'm very lucky because I have a project called Tiara, thanks to the El Khareji family from Jeddah. They are the investors and they trust me 6 years ago. We are spreading the longevity and precision medicine across all Europe. And I'm very lucky because I have an incredible family. Of course, my wife. You said that we all mention our wives, but my wife is especially amazing. I have 2 daughters. They are incredible. I have my father and my brother proud of me from heaven. And I have also a mother and 2 sisters. Really, really amazing family, and I'm very lucky for that. Thank you very much.
Thank you so much, sir. Thank you. Moving on to the next awardee in the same category, Dr. Girish Momaya. Congratulations. He is the director at Stitching Maharishi European Research University. It's Maharishi Ayurveda, Europe. And also, he's an international Maharishi training, is basically covers the aspects of Vedic science. His work is grounded in teachings of Maharishi Mahesh Yoga and the founder of the Transcendent Meditation Program. Congratulations, sir.
great joy and honor to receive this prestigious award from Health 2.0. I would like to congratulate, I would like to appreciate the insight and innovation of 2.0 conference organizers who have brought this expertise from world over in various fields and to bring out this knowledge and practices to pave the way for the world to be better, for human life to be healthier, happier, successful, fulfilling. It's a great honor to be connected. I dedicate this honor, this award to my teacher, Maharishi Mahesh Yogi, who has brought to the world this simple, innocent, effortless, natural technique, profound technique of transcendental meditation, and also who revived Ayurveda, the ancient Indian system of Vedic medicine, to its full, brought that knowledge that prevention is the really basis of healthcare, that with that knowledge of prevention in Ayurveda, we can live life free of disease. He gave the theme to create a disease-free society, and such profound knowledge, so dedicate this honor to him. And finally, great thanks to the whole team of Health 2.0 for their dedication, their joyful contribution here to make every one of us comfortable and take care of our needs, and let the things happen in a very smooth way. Thank you to all of you.
Thank you so much, sir. Moving on to our next awardee. Let's welcome Greta Josepha Gomes on the stage, please. She is a wellness manager at Innovate Healthcare India Private Limited. She designs and delivers high-impact programs from mental health campaigns to leadership wellness strategies. She drives the real results. Fantastic. Greta has partnered with over 200 companies, launching initiatives focused on burnout prevention that have seen up to 3x employee engagement. Wow. We definitely have like-minded people all in one room together, and it's fantastic. It feels like I want to get inside your brains and get all the knowledge.
Thank you so much. I think it's truly an honor to be on stage here today with a lot of brilliant minds like all of you. I think first and foremost, I'm really grateful to the Almighty for giving me this wonderful opportunity. Not to forget my family, who's been my constant backbone and support and confidence throughout the entire journey. In fact, my brother's right here to support me today on this beautiful day. A big thank you to Health 2.0 conferences for this recognition. I think it's a definite reminder that I'm doing something right and a motivation to continue my mission to transforming lives and make a difference in the world. Thank you for each one of you for your lovely insights. Definite big takeaway for me. And yes, thank you and have a lovely day, guys.
Thank you. Moving on to our next awardee. Let's welcome João Asinos. Is that the right pronunciation? João Asicenso. I'm really bad with this now, I feel. I should have sat down with you and got your right pronunciations done maybe. Let's do that tomorrow. Are you around, sir? Not around. All right, moving on to our next awardee, Kimberly. Let's welcome Miss Kimberly on the stage, please. Okay, this, all right, no problem. We will be doing that after lunch once we see her around. Thank you so much. Our next awardee is Mahadvi Subramaniam. Yes. Mahadvi Subramaniam is a founder of Arogya Ashwarya is an international yoga gold medalist, TEDx speaker. That means a 5-minute speech now from you. And best-selling author. She has created groundbreaking Chakra Vitality Excellence, a system that addresses burnout, chronic diseases, emotional imbalances at their root. She embodies her mission by helping women live a joyful life. That's what we want, right? And also, it's called Harmonize, Elevate, Radiate. That's HER. That's what she says.
Thank you so much. Recognitions like this do tell us that we are doing something right. We are on the right path. Thanks to Health 2.0. And thanks to my husband who's here to support me, always supportive. And congratulations to all you amazing people. All of you are, it's room full of amazing individuals doing wonderful, job in the space of health and well-being. Thank you so much. I'm really overwhelmed to be here today. And let's make this world a healthy and joyful place. Yeah, thanks.
Thank you. Moving on to our next awardee. It's in the category of Visionaries Award. Goes to Dr. Michelle. Dr. Michelle, if you're around, please step up on the stage. I believe he's not around, no problem. We'll be doing it later for him. Moving on to our next awardee, let's have Monique Heliu. Monique Heliu, is that the right pronunciation? Monica Heliu, that's right? Okay, Monica is the managing founder of Life in Balance 365, dedicated to pioneering holistic health, a PhD candidate in lifestyle medicine. She integrates traditional practices with modern technology. Her profound expertise is showcased in her innovative Balance Boost app. You can download that now. And her authoritative books on neurodegenerative diseases. Fantastic, ma'am.
Thank you. First of all, I'm very grateful and thankful for this award and for being with amazing minds and people. Secondly, this award, I feel it's a recognition of the mission that drives me every day to work, and which is to make preventive lifestyle medicine accessible, practical, and transformative to to my community and to the next generation. So, and I would like to dedicate it to my Father in heaven and to my husband, who really, without his belief in me, I wouldn't be here today. So thank you so much.
Moving on to our next awardee in the category of Excellence in Healthcare Award. Let's welcome on the stage Dr. Nada Y. Fida. Dr. Nada? Dr. Nada is Director of Emotionally Intelligent Coaching at Bright Future Consulting, is a Certified Emotional Resilience Coach, EQI Assessor, and Patient Experience Advisor. She partners with leaders, especially in healthcare, to navigate complexity, foster resilient, high-performing cultures, and she's also a board member at ICF, Saudi Arabia. She advances coaching excellence regionally. Thank you.
Thank you, my dear. Thank you, everyone. Thank you for being here. Thanks to my family, first of all, and for the award of here or recognition. Emotional intelligence or emotional resilience is something important in healthcare. As we all in the journey of healthcare, getting through stresses, burnouts, so doing such a thing is empowering me and empowering others, making their lives much easier and happier. Thank you so much. That's my colleague.
That's your colleague. Okay, you want to thank your colleague for taking the video. Thank you. All right, moving on to our next awardee. Let's welcome Navra Farhan. A round of applause. She was also one of our panelists. She is the Corporate Quality and Patient Safety Director at Dr. Suleiman Al Habib Medical Group. With 20 plus years of experience, she is pioneering as a Saudi leader. She was the first Saudi ambassador for the Patient Safety Movement Foundation, and she's shaped the respiratory care field and has led pivotal projects like Tele-ICU and patient safety frameworks. She's earned many national awards. Congratulations on that.
So first, I'm going to correct my name. It's Noara Farhan, and I'm from Saudi Arabia. And thank you very much for this great recognition. Thank you for the presence in a room full of talent and amazing vision. They say that safety is the dynamic invisible. But this recognition today proves the opposite. Safety is very much visible in every aspect of care and within the future of care. So thank you very much for recognizing me and recognizing patient safety. Thank you.
Thank you. Moving on to our next award is in the category of Conference Outstanding Organization Award that goes to Presense. Can we have Presense from Presense Vijay Jagannath, a senior consultant of the organization, to receive the award. Presense is a revolutionizing healthcare with AI-powered real-time clinical intelligence for hospitals worldwide. Its seamless platform that integrates bedsides monitor, EHR systems, wearable biosensors to predict patients' deterioration early, automate documentations, and streamline workflows. Fantastic on that. I think you were discussing the same thing on the panel as well.
Thank you. Small correction. So my name is Ashwin Bell, but Dr. Jagannath is right there in the background. He's also equally receiving this award. I'm just on the stage. Yeah, he can come up if he wants, but yeah. No, but as he walks up stage, so we have assembled at Presense a fantastic team of engineers, doctors, and really all of us, we have had deep experience in technology as well as being embedded in hospital systems. So we understand the problems from the ground up, and we're trying to use new technology, particularly AI, in trying to solve all of the problems that the clinicians have. And ultimately important to save patient lives as much as possible. So that's our mission, and we're driven for that. Thank you.
No, that's fine. So as a medical professional, it's wonderful to collaborate with our AI team. So looking forward to more innovation and adoption in healthcare. Thank you so much.
Thank you. Moving on to our next category is the Visionaries Award. I would like to welcome Dr. Raymond Sandoval, also one of our keynote speakers today. So Raymond, are you here? Dr. Raymond. All right, we will be doing this post-lunch, hopefully. Moving on to our next awardee in the category of Excellence in Healthcare Award goes to Russ L. Wright. Can we have you on the stage, please? Mr. Russ, or Mr. Ross, as you like to call it. Mr. Wright is the founder and managing director at Vital Projects. As a visionary behind Vital Hub, Russ has pioneered a tech-enhanced, trauma-informed model that integrates VR neurofeedback mind tracks and also value-based mentoring to deliver. He's not around? Okay. No problem. Seems like we don't have a lot of awardees. Also, people who have received the awards, everyone, please stay back and don't leave the room because we are going to have a group picture. So just giving you that heads up. Moving on to our next awardee in the category, of course, of Excellence in Healthcare, Dr. Sampson. Dr. Sampson, are you around? Okay. Next one is in the category of Outstanding Organization Award, goes to Sukoon. That's you. Okay, we have. So it's been received by the co-founder Kamal. Mr. Kamal? Yes, all right. Mr. Kamal, it'll be received by Mr. Kamal. And this is basically a meditation app called Sukoon, or Sakoon as you like to call it. It's a musical platform that blends Eastern meditation wisdom with Western neuroscience to create music, guided meditations and affirmations promoting mental well-being and health. Congratulations. You would like to say something about the application?
Thank you, everybody. Thank you for the award. I just want to say I'm receiving this on behalf of my team. My co-founder is a little bit under the weather. I have an amazing musician I work with, and he does a lot of music in terms of mental health and supporting kids as well. So thank you, Yahya. Thank you, Faris, Iman, and everybody who created the app and supported in the making of the app. So we blended the Far East with the Far West to create music for the Middle East and to help mental health in every single way. So thank you for everybody, and thank you.
Thank you so much. Moving on, in the same category of Outstanding Organization Award goes to Swasthya by Kinjal. Swasthya by Kinjal, are you around? Thank you. So this is a wellness platform delivering the innovative Get Your Life Back app grounded in extensive research, psychological principles, and 6 years of founders' experience. So Kinjal Patel is a founder and CEO of this application of this organization. And this app features a structured 6 weeks of transformation course, customizable 6 weeks of vegan meal plans and nutrition guidelines to reclaim vitality through self-belief, yoga, mindfulness. I need to connect with you later. Thank you. Thank you.
I want to say thank you to, of course, Health 2.0. I have attended the Las Vegas one. This year I'm doing the Dubai, and let's see what future holds me. And what I'm working on right now after finding the Swasthya by Kinjal, which is health and wellness. I recently started working on finding a non-profit organization about Immortal by Queen. I'm an immortal queen, so I'm start working on that, how to make humanity immortal and lift ourselves from pain, suffering, health, the death, and the birth cycles. So I'm trying to skip all those cycles and raise the humanity above to have an upgrade in mind, body, and soul. So let's see how far I can reach and how far and how many souls I can help. Thank you.
Thank you so much, ma'am. Moving on to the awardee, next awardee in the category of Excellence in Healthcare Award goes to Thelma, Liverpool. Ms. Thelma, Liverpool, are you around? Thelma, Liverpool. She is the president and CEO of Thani Holding Corporation, driving innovative solutions for elderly care and product development. Her distinguished career includes over 2 decades of experience in chemistry and environmental affairs, including senior roles at DuPont, where she managed regulatory compliance and proprietary research, and she blends scientific knowledge with international cross-culture health. Over to you, ma'am.
Thank you very much for this award.
I've seen an 18-year-old, and now you're seeing an 81-year-old get an award for this. I accept this award on behalf of my team and my family, and I thank God for this, and I thank you for inviting me here. Thank you very much.
Moving on to the next award in the same category of excellence in healthcare. Dr. Usman Wahid, round of applause for him as he steps up on the stage. He is the MD FSCS, SCSW, and also the CEO and the Doctor of Healing Hands, Wounds, Care and Surgery. One of the Maryland's premier practices, a graduate of the George Washington University, he is highly regarded as a general surgeon and wound care specialist, known for advancing innovative solutions in the patient care.
Thank you so much. So thank you, the organizers of the Health 2.0 conference. You guys did a great job. Also, I wanted to thank my family, my wife included in that. And I also, just really briefly, I know we're all trying to get going, but I wanted to just bring some light on the topic of wound care. It's not very well known about in this part of the world, or really most of the world. But when you guys see people, you know people who have wounds in their legs or on other parts of their bodies that are not healing. There's really nowhere to go. A lot of times these wounds can isolate people. It can keep them from being interactive. It can be very painful. It can be very devastating. And families that are taking care of elderly with wounds, they also don't know where to go. It can also be very challenging for them. So if this award can shed light on this subject and let you guys take a look at it and become more educated about it, I think that will be a good thing and be a wonderful thing. So thank you again for the award. Thank you so much.
Moving on to the next awardee is Dr. Vibha Jain. Dr. Vibha Jain. All right, ma'am, hopefully we'll find you after lunch. Moving on to our next awardee is Miss Waila Panzeri. Miss Waila Panzeri. Or Viola Panzeri, as you like to call it. However it is. Miss Viola is a product owner at the Medtronic Digital Technologies and a healthcare product leader with 11 plus years of experience. She focuses on advancing digital healthcare through AI-powered touch surgery, video ecosystems, which enhances surgical workflows and patient outcomes. She holds an MSc in medical biotechnology. Over to you, ma'am.
Thank you very much for this recognition, and thank you, Health 2.0, for this amazing opportunity and for supporting the future of healthcare. This award isn't just about me, it's about the amazing teams I work with, clinicians, key opinion leaders, engineers, who are really, really proud and supporting innovation of healthcare. And they believe that innovation should be driven by real user need and real use cases. Thank you very much.
Thank you so much. I would like to welcome Zafar Iqbal to receive the category award of Visionaries Award. Mr. Zafar Iqbal. He is a manager of imaging information systems at Sidra Medicine in Qatar. He oversees radiology, dental, cardiology, PACS, VNAs, and imaging analytics. As a founding member of Sidra's 3D printing lab, he has supported complex surgical planning through patient-specific models. A gold medalist, as he likes to say, and receive one, and of course with multiple award winners as well.
Thank you so much for the organizers. It's been a great conference and great show. I would like to congratulate them, and I would dedicate this award to our patients. We are a tertiary care pediatric hospitals. All our patients, most of our patients are actually below the age of 2 and 3 years, so many newborn babies. And we are trying our best to provide all sorts of care to the patients, and also it's for the parents as well. So thank you so much. Thank you.
Thank you so much. Moving on to our next awardee in the category of Conference Excellence in Holistic, in the category of Holistic. Let's welcome with a round of applause Ms. Lakshmi Samantara. Ms. Lakshmi, are you around? Okay. So she is a founder of Natural Holistic Healing and is an IIT and IIM alumni. She's a scientist and inventor of 10 patents with 16 plus years of experience, of global experience, and she integrates nutrition, energy, medicine, quantum healing, and holistic therapies. Fantastic. Recipient of multiple innovation awards, including from GE and Swami Vivekanand Youth Achiever Award. Congratulations, ma'am. And one more award.
Thank you, everyone. Thank you, Health 2.0. It has been a great event, and thanks to all the organizing team. This award goes mainly to our customers, who is actually making us feel proud and help us to evolve as a human being. And of course, to our family and to the divine, and everyone in this conference room that have connected over the first few days too, and still connecting. Looking forward to connect with some of you, and have a great time. Thanks, everyone.
Thank you so much. Let's welcome the next awardee in the category of Excellence in Healthcare. It goes to Mr. R.D. Vangeven. Mr. R.D. Vangeven, are you around? Okay. He is the CEO and founder of Medibank with the years of experience across business development, risk and compliance, project financing in Australia. He has proven track record of establishing scalable, profitable, sustainable operations in the BFSI sector. He's built multiple partnerships, mentoring professionals.
Thank you, Health 2.0, for this. I guess I need to change my profile because my whole experience has been in the BFSI sector, finance, investments, and all. But when I moved back to India, my home country, 2 years ago, I decided to move into healthcare. So I'm the CEO and founder of a startup called Medibank India. What we do is we are trying to change the healthcare ecosystem in India. For the attendees from UAE, Dubai, and all, it's something similar to what you have at Naveed here, but an upgraded version of Naveed. And recognitions like this say, it gives us confidence and the morale that we are on the right path and we have a long way to go. Thank you.
Thank you so much. Moving on to our next awardee. Let's welcome with a round of applause Mr. Zaki Khan. So Vail Zaki Khan. Mr. Khan is an experienced pharmacist currently serving at Al Noor Specialist Hospital, that is Ministry of Health, Saudi Arabia, specializing in inpatient, outpatient, and logistics support. His diverse career began as a medical sales representative at Eli Lilly Company and includes senior roles at Medinat, Saudi Arabia. He comes with a strong background of IV therapy. Congratulations, and of course, osteoporosis. You want to say something?
I would like to thank Health 2 Conference for an amazing opportunity, and thank you very much for everything.
the next awardee. It keeps going on, right? I know, but this is the list of awardees, and because you all are such like-minded, we don't want to stop and keep giving the awards to you. But I promise just last 2 left. All right, moving on to our next awardee in the category of Visionary Awards. It goes to Mr. Dera Dekha. A round of applause. He was also one of our panelists today morning. And a little bit about him before he steps up on the stage. He is a CEO and a counselor at 7P Healthcare Services and owner and consultant of 7P's Consulting, of course. He's certified solution-focused brief therapy with a counselor with about 23 years of experience in mental health. He has earned national certifications and Medicaid license. Do you want to say something once again, sir?
Thank you, everyone. And it's Dier Dikaha. And when I used to go to conferences, I used to put a capital D space AIR so I can just get it over and out the way. But thank Health 2.0 for this recognition. We as clinicians and providers, we don't get recognized enough. And when I got the email, I thought it was a scam. I said, how'd y'all get my information? I thought it was too good to be true. But what I would like to say, 7P stands for proper prior preparation prevents piteous poor performance. And that can apply for everything, from the technical side to the medical side to the behavioral health side. The more that you're properly prepared for anything in life, it will prevent the outcome from being piss poor. Understand? So we must change our mind to change our life. Thank you.
Thank you, Mr. Dier. That's how you call it, right? Okay, Dier. Dier. Yes, okay. Allow me to welcome our next awardee. Let's welcome Maida Al-Ahmed. Miss Maida, are you here? Okay. Maida Al-Ahmed, she is a General Manager for GCC countries and Director of Strategy and Operations at Bristol Myers Squibb.
What an honor to be here, and thanks for the organizers for celebrating progress in healthcare. Actually, it's an honor to be here. This recognition does not go only to me personally, it goes to all my colleagues at Bristol Myers Squibb. At our company, you know, from research and development up to commercialization, our mission is to develop and deliver innovative medicines to patients in order to prevail over serious diseases. So this is our objective all the time, is to ensure that our innovations comes faster to patients. And you know, Dr. Raymond was speaking about immunotherapies. I'm proud to say that Bristol Myers Squibb was the first company to bring in checkpoint inhibitors worldwide. So I'm proud of the mission that we do. We keep the patients at the centers of everything we do every day. And I'm happy to be part of this organization that supports patients' lives and transforms patients' lives every single day. Thank you again for this recognition. Thank you.
Thank you so much. And before we break, we have last awardee left. And I also request you to please prepare your plaques so we can line up for a group photo. Let's welcome with a round of applause our last awardee, Miss Iman Navravi. Are you here, Miss Iman? Yes. I remember seeing you yesterday. All right, Miss Iman is a PMO and Imaging Informatics Manager of Clinical Digital Health at Al Salama Hospital. She comes with over 15 years of experience at the Saudi Ministry of Health and Afghan Healthcare. Her expertise covers health informatics, health and information management, revenue cycle management, data analytics, and team leadership. Fantastic.
Everyone, Health 2.0, what an amazing audience. What an honor to be here today, to be among such an amazing leaders. My award, of course, is dedicated to my family and my workers and my team, and first of all, every physician, healthcare provider who dealt with technology, bared with technology during implementation. What a pain. That's dedicated to you. And I'm going to record this video so all my healthcare provider will be watching it in the future to know how important to give a chance to technology. Thank you, everyone.
Thank you so much. Thank you so much. With that, we come to an end. And of course, I would like to thank you so much, ma'am, for doing this honor of presenting these awards and doing these awards for such a long time standing. I hope you're doing okay, and thank you so much. We have furthermore to do. In the next set is furthermore bigger because of the like-minded peoples we have. Thank you so much. Thank you. All right, can I please request whoever is around for a group picture with your award? If I believe few of them have left the room and they are not around. Whoever is around, please join us on the stage for a group picture. On the stage, please. Once again, a big shout out and thank you to all the panelists, moderators for this half-day session today. After this, we will be breaking for lunch and then we'll be resuming back. I'll be giving you a time, so let's follow that time so everyone gets enough time to speak. Is anyone else left? You can join us still with your awards on the stage. Thank you so much. Thank you so much. All right. Hoping to see you all back at 2 p.m. sharp. We have literally skipped the lunch hour. I hope you all are not hungry. Thank you. Thank you. See you back. We all are hungry now. See you back exactly at 2 p.m. in this room. Thank you.
Yeah.